Please try with as many as you can so that parents can benefit. So typically when parents have these symptoms or patterns which they do not clearly understand and do not deem those patterns as normal, I'll talk about those patterns also. Then the first thing everyone does, they start Googling. And then they start associating those symptoms with different labels and pattern. Is my child ADD or ADHD or autism or mild autism? And these are, many of you would have heard these names and labels for the first time. Yes or no? ऐसा हुआ है लोगों के साथ? Yes or no? क्या आपको आपके बच्चे में सिम्टम्स, पैटर्न्स, बिहेवियर, समझ, बोलने की क्षमता, खाने की क्षमता, सोने की क्षमता, सही समय पे सोने की क्षमता, दोस्त बनाने की क्षमता, आँख से देखने की क्षमता, इमोशंस होने की क्षमता. I'll open up for Q&A, don't worry. थोड़ी देर में वो सब भी करेंगे, चिंता ना करें. But just allow me to speak for a little bit. So all of these different patterns, when you see that your child is not having, which makes him so-called normal, then you start looking at Google. And then you start getting all of these symptoms. So obviously you are confused, you are worried, you go to super specialists. Best to best specialist के पास में आप जाते हैं. What you would have observed that many of these specialists, their assessment, because the assessment is subjective in nature. Assessment हमेशा subjective होता है. कुछ questionnaire दिए जाते हैं. You fill up these questionnaires, कुछ चीजें करने के लिए दी जाती है. So on your child's behalf, you do those things. On a Thursday, the score is different. On a Monday, the score is different. So subjectively, your child is assigned. Any which way, there is a subjective understanding of an individual expert. And some would call it ADHD, some would call it mild autism. Some would say that abhi nahi keh sakte, after 4 years, 5 years, after a certain period, probably we can assign some sort of a label, but not now. He is under observation. Is that something which has happened with you? Yes or no? Irrespective. Yes. Irrespective. Yeah, I mean, it is Hindi and English, Maryland. So it's basically both, but mainly Indians. So when this happens, two things may happen. Okay, so sometimes the symptoms or the labels are same by different experts, because you don't go to one expert, you go to many. And sometimes these labels are different. Okay, irrespective, all the experts are going to suggest you only one thing. Go for a variety of different external therapies. सब लोगों को external therapies बोली गई होगी. Speech therapy, occupational therapy, physical therapy, ABA, and many other different kinds of external therapies, right? Which all of you parents, as per your availability, your financial strength, your mental strength, your time, whatever it is, you put in all your time, money, and effort and invest everything you potentially can, and you work with the child with these external therapies. You do that. Yes or no? अभी तक स्टोरी सबकी सेम है, हाँ या ना? Okay, so what typically happens with all of them. Now, kindly be on mute. We'll open up for questions. I'm not unmuting you. Okay, so okay. So when this happens and you start going for therapies, what you observe is that एक ही चीज को बार-बार repeat कराया जा रहा है. So there is repetition. What happens during a therapy session is basically repetition of different activities, whether it is speech, whether it is some kind of a physical activity wherein you're putting round blocks in a round hole, you're trying to make sounds in a certain way, sit in a certain way, eat in a certain way. It's basically robotic. It doesn't. No problem, Marilyn. So this is English, by the way. So so that repetition of different activities or robotic activities basically can seemingly improve your child, or you might see, आपको लग सकता है कि बच्चे में improvement आ रहा है क्योंकि एक certain stimulus, एक certain environmental condition पे उसको रटा दिया गया है कि इस तरीके से behave करना है, right? तो इसलिए लगता है कि शायद बच्चा improve हो रहा होगा. But as a parent, you clearly understand it is not his behavior which needs to be corrected. He is different or she is different because there is something different within his or her body. As a parent, you clearly know this, yes or no? It doesn't matter whether it is ADHD or autism or X or Y, all of these labels do not matter. But is this something as a parent which you relate to? Yes or no? Yes, Nancy. Yes, it will help, Nancy. Okay. So this is where we will begin with our story. Okay. Up what we understand as parents, as well-wishers, at different, and this is why I'm asking you. आपके पास में link है. You have the details and all that for the workshop. Please make sure that you share with as many groups or as many friends, or I'm sure you are connected with a hell of a lot of parents. Please make sure that you send it to your spouses, you send it to your friends who are having troubled children and all that, and make sure that they also join. Up from here, the exact understanding of what is happening inside the body begins. Okay. Now, all of these therapies, they are going the way they were going. Yes, I'm not saying there are no changes, no advancements and all that. Obviously, everything advances, small little changes hote rehte hain. But how to deal with children in terms of therapies is something which is pretty much started in 50s and 60s. From then till now, एक बड़ा simple सा सवाल है. Should we have understood more about how human body works for a cognitive disorder, for a development disorder? हमको तब के मुकाबले अब ज्यादा पता होगा, हाँ या ना? Yes or no? So the fact of the matter is there is a lot of research, lot of understanding, lot of different scientific studies done in this space, and we clearly understand speech ability. There are 16 patterns. Now I'm going to tell you about the patterns which exist, and it does not matter whether your child is ADD or ADHD or autism or X or Y. It does not matter, please, because for everything सारे सुपर स्पेशलिस्ट आपको थेरेपीज ही बोलेंगे, इररिस्पेक्टिव. यही हो रहा है ना सबके साथ? यस और नो? अल्टीमेटली irrespective of the label, you are given the exact same treatment. Yes or no? So it does not matter whether your child is having a learning disorder, difficulty in calculations, difficulty in understanding languages, difficulty in mingling with children, ADHD, hyperactivity. So there are 16 patterns. Let me tell you about those patterns. The first thing is speech. Now, speech is highly misunderstood. Okay, speech is not a very simple thing. It's not the ability to speak. Most of you would have done the Bera test, and Bera test would have come out to be normal. The ability to hear is there. Okay, if Bera test has come out to be normal, the ability to hear is there. And you would have heard, आपने अपने बच्चे को कभी ना कभी कुछ मुंह से आवाज निकालते सुना होगा, एटलीस्ट एक बार. माँ, पा, पानी, एक्स, वाई, कुछ तो सुना होगा. तो इसका मतलब है सुनने की क्षमता है. The ability to hear is there, and the ability to speak is there. So speech is not necessarily the exact problem. Speech की अकेले की दिक्कत नहीं है. ये आपको समझ में आता है? Yes or no? Could you relate to this? Okay, so what is speech? Now, if you are responding whatever I'm saying, if you're making a response to that, then a lot of things are happening. Okay, you are listening to me, you are trying to make the meaning of it, you're trying to assess a lot of things. मेरी टोन से आप लोग समझ रहे हो कि मैं किस तरह से बात करना चाह रहा हूँ. आपकी पुरानी मेमोरी बैंक को निकालते हो, आपके सबकॉन्शियस को निकालते हो, आपके इमोशंस को निकालते हो, आपके स्ट्रेस को निकालते हो, and all of this calculation happens in a split second. And basis that you repeat whatever you say. Yes, I get it. Yes, I get it has a lot of calculation, lot of different brain sectors working together and forming those neural connections. So speech is not just speech, it is receptive understanding, it is language skills, it is memory skills. There are many things which go into speech alone. Okay, is that something you are able to understand? Yes or no? So the first pattern which we must understand, which is anomalous with these children, is speech. Then related is language, which is what is language? Language means the ability to formulate sentences in a meaningful way. Conversation, to hold conversations in a meaningful way, not just responding robotically, जो speech therapy से हो सकता है अगर cognitive issue है, right? तो उनके in that case speech therapy से एक हद तक वो चीज achieve हो सकती है. But if there is an actual cognitive challenge, then speech therapy would be very limited in its ability to help the child. Okay, because there are certain things which we need to understand and sort out internally inside the body, which is what we are going to discuss during the session. Then there is hyperactivity. Okay, there are a lot of fungal infections, parasitic infections, moon cycles are important. We'll talk about all those things. Okay, we'll talk about gut microbiome, we'll talk about leaky gut, we'll talk about hormones, enzymes, liver function, thyroid function. All of this is in play when we are talking about hyperactivity. Okay, so hyperactivity, why the child is not able to sit stable and focus, ADD, focus nahi hai, right? Focus nahi mil pata hai. 2 minute, 4 second, 10 second, आधा minute, 1 minute, 2 minute, after that they are not able to focus on to anything. How would they learn? How would they learn life skills? In general, take care of themselves. Okay, so then hyperactivity, hypersensitivity. What you must understand is how many of you are aware of this gentleman by the name Van Gogh? I'll type in the name. Okay, he's a very, very famous painter, one of the most popular and most expensive paintings made by this gentleman, Van Gogh. Now, Van Gogh also had these conditions. He was hypersensitive. He could draw patterns in air itself. हवा के अंदर जो ट्रांसपेरेंट है, यहाँ पे कुछ है तो नहीं हमारे और आपके बीच में. Because these children are hypersensitive, they can sense patterns in this empty space also. Okay, yes, Pramila. So they can sense patterns in these. They're getting a lot of information from their different senses, from vision, from touch, from this or that, many other things, right? So why are they receiving so many sensory stimulations? What hormones, what enzymes, what mitochondrial level is hyperactive in them? That is what needs to be understood. If they can, that can be understood. Hypersensitivity could be corrected, completely restored. Similarly, there are fussy eating issues. बच्चे खाते नहीं है. How many of you are having that problem? The child does consume only certain specific things, does not consume everything, does not necessarily chew stuff. He or she swallows stuff. Okay, very selective about taste, texture, smell, all of those different kinds within a food. The food has to be of a particular order. Okay, right? So if this is happening, then there is a high probability that the taste buds are not getting developed. If the taste buds are not getting developed, if you can't taste food, आपको कागज में, ये कपड़े में और खाने में कोई फर्क ही नहीं है टेस्ट में. Everything tastes the same. How would you differentiate between two foods? One is safe, the other is unsafe. Based on what? Texture, mainly how it feels. So whatever gives them confidence in terms of texture is what they want to stick to. This is safe. Everything else is unsafe. However, if we are able to develop those taste buds, if we are able to develop that sensory connectivity between smell and taste and eyesight and everything, then this need to stick to a certain kind of food only disappears. They're able to relish food like you and me, right? So is that something you are able to understand? Like that, there are patterns. So today what we are going to understand is what are these patterns, what is happening behind those patterns, and how do we understand those patterns and so on. And tomorrow we are going to discuss about solutions. Okay, does that sound like a plan? Is that good for everyone? And both today and tomorrow we'll take up all the questions. We are not going to leave till the last question is fully answered. And obviously we'll talk about what are the results if you try to solve your child's issues. Okay, by the way, how many of you have heard of functional medicine approach or tried functional medicine approach in the past? Do you know what functional medicine is? How many of you are aware of what functional medicine is? Okay, very few. Okay, just to give you a small little sense of what functional medicine is, it's a mix of both Eastern and Western philosophies. Okay, yeah, traditional और कहना चाहिए traditional philosophies, conventional philosophies वगैरह का marriage है. Okay, so not just lifestyle intervention, but much more. So basically, the best part about allopathic practices or conventional, or you can even call it traditional in a way. So all of these practices, the best part is you are working on proof. You're working on diagnostics. You're working on testing. You're working on concept that you can clearly understand in black and white. And basis that there is standardization of different interventions. Could be many, right? So this is the great part about Western practices or allopathic practices and all, that you know what you are getting into and how to solve it. It is basically, in a way, sort of idiot proof. I'm not saying that experience of doctor and capability does not matter. Of course, it matters a lot. But the point is there is still a high degree of standardization. But the challenge is it is working specifically on systems or organs. अगर developmental issue है, cognitive issue है, तो brain से ही होगा. जबकि modern research studies सब कुछ हमें समझाती हैं. There is a very strong connection with gastrointestinal tract, how your hormones and enzymes work, how your nutritional deficiencies, how your mitochondria works. All of this, which is what we are going to understand during the session. Okay, so how do we understand these biochemical pathways or interconnectivity of different organs? Now, on the other hand, Ayurveda, Unani, Siddha, all of these different practices, they may not be wonderful diagnostics, but you have to rely upon an individual's ability and experience, but it at least treats the entire body as a whole. Having said that, the problem is there is no black and white. You have to blindly rely onto the ability of that individual practitioner. Now, functional medicine marries both of them. There are a bunch of tests, bunch of diagnostics which help us clearly understand and identify the root causes of the chronic condition and also treat it holistically and the entire body as a whole. So what I'm going to do is I'm going to play a very short video to help you further understand what is going on, how does this entire thing work, and basically इसके पीछे का कॉन्सेप्ट क्या है, मतलब किस तरीके से फंक्शनल मेडिसिन काम करती है. Just allow me a second. Okay, there is a short 1 or 2 minute video. Please don't mind. इससे थोड़ा सा काफी लोगों का कॉन्सेप्ट क्लियर हो जाता है. So it becomes much more clearer to a lot of people. So that's why I'm sort of playing this.
Functional medicine is a science-based whole systems approach looking at the fundamental underlying causes of clinical symptoms.
We're looking for not what is wrong with this person, but why this person has an issue. It's not alternative medicine. It's not an either or. It's simply taking some of the new findings from systems biology and how all kinds of different influences can impact a person's health.
When you can understand the underlying causes of the disease versus just diagnosing the disease itself, you can have expanded options on how to treat that disease.
So many other practitioners are looking at what are the symptoms and what do I quickly do to treat those symptoms. I'm much more interested in what happened, what created that problem to begin with, and that's really what functional medicine is all about.
When it comes to the patient outcomes, and what I've seen for them is that they can appreciate the idea that I'm looking at them as an individual.
Getting from the patient through their own words, their experience. We now know that genes plus experience creates the phenotype that we live in the world. So we have to understand where the person is coming from.
We are looking at the way the body works in systems versus focusing on just the disease.
We're looking at genetics, toxicology, nutrition, psychospiritual issues, trauma, the whole big picture.
This gives us a set of tools that we can use to work with patients in a very systematic way. When they've got a chronic problem, they'll unravel the cause of that problem and then address those underlying causes.
And you're giving them the roadmap, you're giving them the instructions, you're giving them the algorithm
about how they can help themselves. You are engaging them as active participants in their care.
So the way that it's organized, the way that it's put together, would give everyone that ability to change that patient's life for good.
So I hope it made this a little bit clear. What functional medicine is and how it approaches is not a different kind of medicine or anything. It's just basically a way in which we can diagnose the underlying root causes or what is malfunctioning in different biochemical pathways. Or in other words, why is fussy eating there? Why is speech lacking? Why is hyperactivity there for your child specifically? I hope it is clearer now. Please type in yes if you can understand what is functional medicine a little better now. All right, perfect. So we'll begin the session. These are a bunch of names. All of you parents, please type in how many names you can recall. I want to start on a positive note. All of these guys are champions in their respective fields globally. Okay, politics, actors, business people, all different kinds of people, top of their spaces, right? Scientists, inventors. There is only one thing which is common in all of them, and that is all of them, they are having some kind of a developmental issue. All of this is possible for your child also. In fact, it is much more possible for your child compared to a normal child. The reason is they have special abilities. As I said their senses are enhanced. If you remove the roadblocks, their focus would be much stronger. So it's much more possible for a challenged child, so-called challenged child, to outshine everyone else. All we need to do is we need to understand their roadblocks and remove them and enable them to grow in the manner they wish to, they deserve. Okay, so please keep typing in how many people are you aware of, whether it is 1, 2, 10, everyone. Okay, please type in. Please give me your responses. Now, as I said, the first thing which I said, I kept on saying all of these different labels do not matter. What matter is the patterns, and what matters is the reason behind those patterns, which is what we are going to understand in the next few minutes by Dr. Ashwini. Now, I'm very proud to share this space with Dr. Ashwini. Dr. Ashwini is one of the primary shining beacons of functional medicine practice in India. So he is one of the foremost doctors in the functional medicine practice in the country. He is not just a doctor, he is also a teacher. He conducts several courses and programs to teach more and more people and enable a lot of doctors to come into this space so that they can help many more people. He's also an author. He's also a co-founder of Indian Association of Functional Medicine Doctors, which is a premier sort of congregation of functional medicine doctors within the country. He deals with a variety of conditions, but most importantly, he deals with developmental issues. He has been working across this space for several years now. So together, we have conducted about 23 batches. Every month we have one batch. And altogether, we have around 1,200, 1,300 parents who have joined us across 41, 42 countries. And we have seen sizable growth. At least 15 to 20% of children are completely diagnosis-free in every possible measure or way, irrespective of age groups. It's starting from 18 months till 22 years. Whether it is speech or cognitive ability or learning disability or CP or Down syndrome, we have worked across the spectrum. Okay, and at least people who are able to comply at least 60-70% of whatever we prescribe, at least 94% of children gain at least 25 to 30% of recovery within a span of 3 months. Now, with this positive note and tremendous contribution that Dr. Ashwini has had over a period, I would like to welcome him. Over to you, sir.
Thank you. Thank you so much. Good evening, everyone. So thank you so much to Ayush also, because we have so far, he said 1,200 or 1,230. I think it's more than 1,600 children we have worked with, Ayush. So it's your contribution. We are able to get to that number. And of course, with a significant improvement, it's a very tough problem that we are dealing with. But for parents, I want to tell you that possibilities are immense. Now, today I will just, intention for us today is just to help you understand what is wrong with these kids or what is causing the problem. Okay. Now we understand to some extent that if there is a root cause to the problem, then possibilities arises for these children. Most of the time we are told it's a genetic problem. Most of the time we are told it's just a neuroatypical child, and you do therapies, nothing major can be done. This is absolutely, I would say, it's a medical condition and it needs medical intervention in the right way. Okay, so we'll discuss a lot more in detail. Idea just you with a very open mind. Okay, doesn't matter what somebody has told you, what you have heard, it's all right. All of us are trying our best to, all different medical community people, healthcare professionals, all of us trying our best to give you the answers. When I'm saying something, go with a very open mind, so that try to grasp what we will discuss today or tomorrow. Okay, so for the body to be healthy, our immune system is to be healthy, our metabolic function, which means mitochondria, to be healthy, our digestive system to be healthy. Unfortunately, these three systems are not into place in autism or ADHD or similar problems. Not that these problems just come out of nowhere. There is a reason why child is behaving in a certain way. Okay, and until we find out, until we resolve the problem is not going anywhere. Sometimes we do therapies, for some time we see some level of recovery, but then if problem is not going anywhere, it can come back. It's a dynamic situation. It's not a static situation. If child has, let's say, some problem today, we don't fix the problem can grow. But if we can fix the problem will come back and it can resolve also. So like that. So it's nothing static here. More importantly, we have to understand now, just for the parents where the child is recently diagnosed and you're lost. Now, early detection and early intervention can increase your chances of recovery completely. Now, if a child comes to us at the age of 2.5, 3, 3.5, 4, a lot can be done. Okay, of course, as the child gets a little older, amount of effort to be done is more, but recovery still can be made. Okay. Now, if you see your child having accelerated growth of the head, which means there is an inflammation in their head. That is one very, very abnormal sign that you can pick up easily that something is not right in your child. If your child doesn't eat well, excessive eating or lesser eating, both is a problem. A lot of these kids, they eat excessively, okay, which is more common than they are not eating enough. So eating too much food is also a problem. Now, there are reasons behind that we can discuss in these 2 days also. If child doesn't allow you to touch or anybody else touches, because they probably feeling a lot of pain in the body when somebody touch. Not that they don't like the touch, just it's not convenient for them. It's not easy for them. Okay, if there's a delayed crawling, late walking, muscle tone is very poor, doesn't have eye contact, doesn't react to the voice, doesn't smile, always crying. Okay, lack of activity or just running around, not settling down, not sleeping well. Now, whatever is written or whatever I mentioned, there has to be a reason behind those behaviors also. Not that excess eating is a habit only. Not eating is a habit only. No, these habits have certain reasons behind it. And until we go beyond the conventional way of thinking and start looking into deeper, there arises a possibility that we can solve this problem. Okay. Now, the hallmark of this autism is delayed gesture pointing, slow to the name being called, slow language, slow communication, repetitiveness. Now, this is the typical way of diagnosis. But if you look at these kids, they have so many other problems also. Their problem is not limited to these symptoms and signs. They have so many other problems, but unfortunately, we get hold on to this only problem and try to solve what is the diagnosis. Sometimes we should be going beyond the diagnosis also. Okay, so it's just not something only wrong, something with the brain. That somehow the brain is only unwell, rest of the body is healthy. That is not the case. Okay, if their brain is unwell, there could be so many other things also not right in the body. Okay, so point that I'm making is we cannot just make the brain healthy and make this socialization better, communication better, and relationship better. Before this happens, we have to make their body healthy. As the body becomes healthy, brain start becoming healthy, these problems start getting resolved. Now, when we're only focusing on these problems, we don't care what is the bodily problems, what are the issues the child otherwise is having. We only focus on it. This is making this problem to be very, very difficult problem to solve. Okay, but at least when we start walking in the right direction, there comes a possibility. Similarly, ADHD or autism, they rarely occur alone. Okay, they could be distraction, anxious, learning behavior, all that is more of typical signs. But along with that, a lot of these kids have epilepsy. 90% of them have GI problems, sleep disorders, feeding disorders, okay, OCD. So this is not just a brain problem. This is a bodily problem. Now, if the body is unwell, because of that, the brain is unwell, because of that, there are symptoms. Not that symptoms are a problem by itself. So that is something you need to, as a parent, you need to little bit, develop this understanding for yourself that, why is my child behaving in a certain way? It's not just they're deliberately doing. Things are not under their child's control. And why it is not under their control? Because their body is unwell, their brain is unwell. So this is something we really has to look little deeper. Now, when a child is diagnosed, parent is lost, you run around looking for an answer. Okay, most of the time it is given, an answer is given to you that this is probably a genetic problem. Then you look around, I don't have a problem, my wife don't have a problem, my hubby don't have a problem, my family don't have a problem. So how come my child has a genetic problem? So is it really a genetic problem? Now, if you look around, look at the data, or when you and me were younger, I was 5, you were 5, we would hardly find any child with a problem. It was a rare problem. 30 years back, 40 years back, it was a rare problem. But today it is a common problem. It's so unfortunate that so many of the children today having some level of difficulty, and many of them have a lot of problems. Now, almost 1 out of 100 today having some level of problem, or 1 out of 60 developing autism or ASD at least. Now, if you see, the human genome have not changed in the last 30, 40 years. Our genes remain constant. But prevalence of the problem have gone leaps and bounds. It's just crazily high, which is very unfortunate. But we are still blaming our genes for the problem, which probably genes are not even contributing to. Because numbers doesn't justify the increase or the increased prevalence of the problem. Okay. Now, if genes is not the problem, then what else is the problem? Now, as per the Autism Research Institute, they say it's a whole body disorder. The brain is affected by the biochemistry generated in the body. The brain function depends on the biochemistry in the brain. If this biochemistry in the body is abnormal, which is also affecting the biochemistry in the brain, that is leading to the symptoms and the behaviors that your child is having. Not necessarily that there is a genetic problem. Now, if biochemistry, which is more of a biochemical problem, if that is wrong, then we should be working on fixing that biochemistry rather than just trying to fix that problem behaviorally. If I am hungry all the time, I'm hungry for some reason, instead of you putting pressure on me to stop eating, try to fix what is wrong in my body. Because of that, I'm always hungry. If my child is agitated, my child is always crying, my child is not happy, my child is not allowing touch, my child is not communicating, what is the reason behind that? Until we find that reason, how do we even solve that? But unfortunately, most of us are looking in a direction which might not even take us to any destiny. Okay, so I think this is the major point. The takeaway for today's presentation is it's not merely a genetic problem, but hardly a genetic problem, I would say. And it is just not a brain problem, it is a bodily problem. Because body is unhealthy, biochemistry is unhealthy, biochemistry, the brain is unhealthy, that is leading to these behavioral issues. Yes, there are so many nuances which we need to know and fix it and all that, but at least fundamentally, you understand that is a biochemistry problem. Okay, simply putting. Okay, just to give a glimpse of that, just a basic understanding. Okay. Most of the kids are born normal. Most, I say 80-85% of these kids are born normal till the age of, let's say, 1.5, 1.8, 2 years. So child was developing normal, milestones were okay. Then something happened and regression happened. And most of the kids that you parents are dealing with might be regression cases. Not that any child born with a problem, still we can do a lot of recovery, but at least just to make the point that if it was a genetic problem only, the child should be having a problem from the beginning. Okay. Now, if it is a regression case, then clearly something went wrong during the development period. Not that the child is born with the problem. Now, what could have been gone wrong? Just two examples. Don't want to, get too much into it. Just basic this thing I want to give you. Now, a lot of time, any infection this human body gets, we think it's a bacterial infection. Somehow this medical system consider this every time it's a bacterial infection, every time antibiotics are given. It's a fungal infection, antibiotics given. Bacterial infection, of course, antibacterials. Even viral infections, we give antibiotics. Now, when we take antibiotics, we disrupt the healthy balance of the microflora in the body. Now, when healthy microflora balance is disrupted, more yeast infections will grow, more fungal infection will grow. Now, these fungal infections will make a lot of toxic waste, which are neurotoxic. They're toxic to the brain. Something that is produced by the fungal infections is toxic to the brain. Okay. Now, this causes inflammation. This causes symptoms. Now, imbalance of the microflora after antibiotic can cause increased gut permeability. The intestines become more permeable. Now, that also start affecting a lot of cellular processes because a lot of toxins are going in the body, and that start affecting the brain. Now, you see, the child might be normal, then disruption happened, then symptom appeared. Now, if symptom appeared because of disruption, should be fixing the disruption or should be just doing therapies? So very, very fundamental. I want, not that I'm against anything. It just, I want to put you a right perspective for you parents, so you understand. Okay. The second disruption that, not that I am saying, research is fairly okay with that also, that after a lot of parents report to us, we have almost worked with the 1650 children so far. This is significant data, and many of them have reported that after MMR vaccine, my child started showing regression. Now we know for a fact that vaccinations have mercury and some form of the mercury or aluminium or some form of the aluminium into that. Okay. Now that goes into the body, that causes immune dysfunction regulation. Thereby, immune system goes haywire, autoimmunity start building in the body, and brain start regressing in the function. Now you see, the child was not born with the problem. The problem comes later in their life as a regression due to some incidents. There could be so many other things also. Maybe COVID, the child was looking into a lot of mobile screens and Wi-Fi's and dehydration, poor food, a lot of other things also. I'm just giving you two very, very prominent examples, which could have been played a role in your child's, regression. So if we have to solve the problem, we have to look into the right direction. Now, if I don't even connect the dots, if I don't try to find why did my child get a problem, how do I even solve the problem? Okay, so functional medicine is nothing but trying to look into the right direction. Why did this problem occurred in the first place? There has to be some reason to it. Just cannot be that all of a sudden out of nowhere, my child start having a problem. No, there has to be something. Now, as the science is progressing, we get new answers. Okay, science is all about knowing the truth. And as we're learning more things, we get new answers. We blamed mothers, then we have been blaming the genes, then we say only external therapy is the answer. But today, fairly we understand that it's an epigenetic problem. Now, there is genetics, there's environment. This environment can be antibiotics or good flora, could be toxins or a clean environment. Now, genes will always remain constant, but environment can change the expression of the gene. This is very, very simple biology. Okay, nothing new I'm telling. And all of you might have learned in your 10th school and all that, or even +1, +2 biology. So environment can affect the genes either to manifest disease or to manifest health. Okay, not necessarily that there's something wrong with the genes. It's just simply the bad environment which can cause genes to manifest a disease. Now, if we want to bring back the disease, when these genes remain constant, all we can do, or what we can do, is changing this environment once again back to normal. Now, all we will be trying to do is changing the environment once again back to normal, and these genes will start manifesting health once again. Okay. Now, this body, our body, is designed for health. We are not designed to be unhealthy. We're not designed to be sick and diseased. But unfortunately, our society have become sick and diseased because environment that we're keeping our bodies under, within the body, outside the body, is all sick. That is why we are sick. But if we change the environment for you or for your child, body will start manifesting health once again. Okay, so nothing wrong, no rocket science we're talking about. Very, very simple fundamentals about health. I'm not saying anything very new, but sometimes we, go around and come back to the same point that we have been saying for thousands of years, as this country has a culture of Ayurveda, a lot of other naturopathy practices, which says that the fundamental has to be done. Now, if we don't do the fundamentals of the health, then we don't get our health back. Okay, so 80 to 85% of the kids today develop this problem are primarily because of the poor environment, which is epigenetic. Okay, now we need to know what are the environmental changes that are triggering the problem in your child, what are they within the body, outside the body. We fix that, the child will slowly start repairing the body, and the disease will start regressing. Okay, instead of their health is regressing, the disease should regress by changing the environment. You wonder what are the possible reasons. Okay, I put down a list of few things. Few of things you might have heard, few might not have heard, but with an open mind. Oxidative stress. These kids have a very, very high oxidative stress. A lot of oxidation is going on. These kids have a lot of dysbiosis, infections in their body. Chronic infections. They might not get a fever, but they might have a warm body. The head might be sweating at night. Okay, they might not have acute fever, but they feel feverish, they're tired. They might be sweating a lot. That is this dysbiosis. By definition means infections in the large intestine and SIBO, small intestinal bacterial overgrowth. SIBO, SIFO. Infections in intestines is a big problem. 90% of them have a digestive health issues, and this is because of the dysbiosis and SIBO. Now, as we start solving this problem, child start showing better behaviors. or regression of the disease. Food intolerances, food sensitivities, parasitic infections, a huge problem. Huge problem. I'm sure nobody has told you before that parasitic infections can give symptoms which look like autism. Now, if you do a CBC for your child, complete blood count, look at eosinophils, it'll be high in most of the cases. And as we start cleansing these parasites, of course, it's a very tough job to clean them. They start getting better. They behave better. They don't shout. They sleep better. They don't bite a lot of things. A lot of these children, they have a habit of putting a lot of unwanted things in the mouth because of the parasites. And as they clean them, they start getting better. They start sleeping better. They start regenerating better. The recovery start happening. Elevated histamines, a lot of them, they have a lot of allergies. Okay, you clean up their diet, you clean up their system, allergies will come down, wheezing will come down, asthma will come down, skin allergies will come down, the brain will start getting better and healing, and you will see child is improving. They have low glutathione, which is a detoxifying master antioxidant. That is low when we test them, it is low. They have an increased toxic burden. They have high on mercury, they are high on lead, they are high on cadmium, barium, lead. Huge problem in the body. Plastics, huge problem. Low vitamin D. Some of these kids have a vitamin D of 7, 10, 12, 15. My God, critically low. They don't get enough sunlight to be healthy. We keep our kids under tube lights, under mobile screens, under Wi-Fi. We don't get them to the sunlight. And then we wonder, why did my child don't behave normal? See, all forms of the life on this earth are powered by the sunlight. All of us are powered by the sunlight, but we don't care really. We have become so smart for our own good. We start shooting into our own foot. If mother was deficit into nutrition, your child will get in deficit into nutrition. Child will not develop normally. It's very, very fundamental, right? You as a mother has to prepare your body before you become pregnant or you give a birth. But unfortunately today, nobody informs us that we have to prepare for a pregnancy. Now, when mother has infections, mother has toxicities, same will be passed to the child, and child will develop into problems. Not that it is coming out of nowhere. Okay, so impaired detoxification, impaired mitochondrial function. So lot of underlying issues because of that. Lot of these children are developing such a problem. Not that it is coming out of nowhere. Okay, I hope this is clear for you to understand. And when somebody doesn't tell, nobody even tells you that these are the problems, you don't even look into this direction, we might not get the satisfactory answers, satisfactory results also. So the good news is, a lot of these things which I'm talking about can be fixed. We can work upon these things. We can reduce the amount of the severity. We can improve the child to the greater extent. To the extent, like Ayush mentioned, many of them can become label free. Sorry, I have a power cut in Bangalore, but I think my internet will be working. So now, based on this new information, let's look at once again. Autism is a multifaceted disorder. It's not just a brain problem. It's a multifaceted disorder where the GI function, GI inflammation in the body, inflammation in the brain, the multiple nutrient deficiencies, multiple food allergies, accumulation of xenobiotics, neurotoxic, which are neurotoxic and immunotoxic. So much toxicities in the body, which is toxic to the brain cells and toxic to the immune cells, their bodily functions hardly happening. And how do we expect them to be functioning normal, behaving normal? So it's not a behavioral problem, people. Parents, it's not just some behavior out of nowhere. No, there has to be an underlying reason behind each behavior. And as we start solving the underlying reason, the behavior start getting better. Now, in case your child is doing some behavior at home, some different behavior in the school, then it's just a pure behavior. Okay. But if your child doesn't know what they're doing, they're behaving same across at home, in the school, with friends, no friends, they are doing this behavior throughout the time, that means they don't have a control. But if your child knows how to behave at home, how to behave outside, how to behave with others, then they can control their body. That means it's pure behavior. But if your child don't even know how to react in different situations, that means it's a pathology. Something is wrong in the body. They don't know what they're doing. That is why they are showing these behaviors to everybody. So this is how you can sort of figure out, is a behavior problem or pathology-driven behavior. Now, as the science is progressing, we're also calling this as a mitochondrial disorder. What is a mitochondria? It's an engine in the cell which makes energy for us. We consume food, we drink water, we get a lot of sunlight, all that, essentially to convert into energy, which is useful for our body. Now, as science is progressing, they're finding that a lot of these children, they have poor mitochondrial output. The mitochondria is not making enough energy. For example, if child has a poor growth, poor muscle tone, fatigue, activity intolerance, exercise intolerance, difficulty in chewing, which is very, very common, difficulty in swallowing, another very common problem, exhibit abnormal behavior, it is a development delay or regression, language, social impairment, ADHD, depression, anxiety, seizure, immune dysfunction, headaches, all of these symptoms and signs are caused by poor mitochondrial function. So if your child is having this, the mitochondria is not healthy. Not that something only wrong in the brain and somehow they are doing some behavior. Now, their mitochondria is not healthy because of these problems, because of that other issues. So if we have to improve these children, we have to improve their mitochondria. Okay, so sometimes things are very, very simple, but then we don't look into the right direction and we never reach the right destination. Now, based on this understanding, let's again relook at functional medicine. It's nothing new about functional medicine, just a new way of looking at the problem. The tools and all the methodologies that we use to treat the problem is almost the same, but digging deeper into the problem, trying to see what is causing the problem is the newness into the functional medicine. So it's a root cause based approach, and is trying to correct the brain chemistry, not the behavior. As we correct the brain chemistry, the behavior will settle down by itself. But conventionally, we look at the signs and symptoms, we put a diagnosis, and based on the diagnosis, let us give some drugs, or we can use some therapies. There's no attempt made to know the root cause. There's no attempt made to correct the root cause. That is why it seems to be a very, very difficult problem, very difficult problem. It is a difficult problem, but then still a lot of answers can be, sought. Now, our bodies, our physical bodies are made of the nutrition, at least that we eat, the water we drink, the light we expose our body to. But when we test these kids, they're deficit in a lot of things. They're deficit in proteins, amino acids, in zinc, vitamin C, vitamin E, antioxidant, phospholipids, iron, magnesium, vitamin D, zinc. So many deficiencies that we find in these kids. How do we expect their body to function normally when they have so many deficiencies? As we start correcting these deficiencies, they start performing better. We are feeding them genetically modified foods. Now, 30, 40 years back, when I say the problem was very, very less, those are the periods when at least we have relatively better quality of food. But today, we have polluted our water, we have polluted our food chain, we have polluted our air. We have genetically modified our food to the extent that our immune system does not accept that food. And because of that, there's a lot of autoimmunity develops in the system. And if we keep feeding our kids the same poor quality genetically modified foods, we don't expect them to get better, because we're not giving them the right raw materials to develop a normal, healthy human body. Then of course, a lot of these kids have a lot of allergies of foods, and we still keep giving those what they're allergic to. Allergic means the body's not accepting that food, but we keep feeding, expecting somehow all of a sudden these allergies will go. They don't go, they will increase only. Our intestines are designed in such a way that we digest our food and we throw away the waste. Now, if your child is constipated, they're not passing the stool on a regular intervals, on a regular every day, which means they're accumulating these toxins within their own body. If it is not getting out, where is it going? Now, if intestines are not kept healthy, they become leaky. Leaky means lot of toxic waste, lot of undigested foods can go into the bloodstream and poison our body, poison the brain, poison the mitochondria. Thereby, we get all of these problems. Okay, then what foods can trigger such a problem? Wheat, barley, rye, with a lot of gluten into it. And this toxic waste going into the blood, all these proteins from the undigested foods going into the blood will also cause biomimicry. And this biomimicry will cause autoimmunity. If you test your child's anti-nuclear antibodies, anti-CCP, AMA, a lot of, and there are a lot of antibodies for the brain tissues also. They might come positive, and a lot of cases it is positive, means they have developed autoimmunity in their system. Now, if you have to make the brain healthy, we have to reduce their inflammation, we have to cut down the foods which are troubling them. We cannot keep feeding the problem and expecting them to do better. Similarly, just like our brain is controlling our gut is also controlling our brain. Now this is called gut-brain axis. Now, when we have a lot of infections into our intestine, small intestine, large intestines, they produce a lot of toxic chemicals, and they also start controlling our brain in a negative way. So that changed biochemistry is giving the behaviors. There has to be reason why a child is doing in a certain way. We are using a lot of disruptors, antibiotics, acid blocker, gluten, painkillers, steroid, high sugar diet, overuse of laxatives, food allergies, processed junk food, body lotion, sunblock, pesticide, plastic, chemicals for the cleaning of industrial and household cleaning chemicals, meat which is not organic. All of them, they disrupt our hormones, they disrupt our digestive system, and our cell-to-cell communication is affected. Our digestion is impacted. We are becoming too much toxins are floating around into our body. And when we test these things, they're high. Okay, not that I'm saying just for the sake of saying, we test all these heavy metals, they're high in majority of these kids. And as we start getting the toxins out of their body, they start feeling better, they start behaving better, they start responding better, they start communicating better. Okay, just like a car engine. If you take away the kachra out of the car engine will perform better. Same with the child's body. 80% of this body is simply water. And when we look around, when we look at the markers, many of these children are dehydrated. They might be drinking more than enough water. They might be drinking excess water. But then quality of the water matters. Just water to be clean is not enough. If you take a RO water, which is clean, but the water is acidic, the water is unstructured, the water does not hydrate the child's body. An unhydrated body, the cell function does not happen properly. Because of that, there is a certain behavior. So if we improve the hydration, child will start performing better. The water has to be structured water. The water has to be alkaline. The water should be carrying some energy. Water should not be dead water coming from plastic bottles. Water is important, guys. Sometimes we think that, oh, my water is clean, it's enough for me. No, a lot of this advertisement of this eco cards and all that, which talks about my water is clean, clean is not enough. There's so many other properties of water. Clean is required. It's a basic mandatory thing that is required for water. But alongside, the water has to be alkaline, has to be energy rich. Energy rich means electrons. But unfortunately, we're drinking electron deficit acidic water, where pH is less than 7. We need more than 7.4. We're drinking less than 7.4. A lot of you parents might have experienced that your child was normal into the lockdowns. When you were inside, your child was looking at a lot of mobile screens, looking at a lot of TV. They started losing their skills. They started losing their speech. They started losing their communication problem. And too much of memory because of the screens or damage done by the electromagnetic fields from the non-native human-made electronic devices is another big problem that is happening to our society. Now that promotes the growth of the pathogenic microorganisms. I said infections is a big problem. Infection should not come from outside. If your child is always exposed to a lot of electromagnetic fields from the electronic gadgets, they can grow infection because the immune system is still poor. A 6-year-old child's body, just to understand the gravity, how severe this is, 6-year-old child's body absorbs 60% more radio frequency from a cell phone or a wireless device than a person in 20s. The body is underdeveloped. They're not fully developed. The skull is not fully developed. Damage is happening to you and me also, but the child is having more damage than an adult. That is why a lot of regression. Heavy metals, petrochemical, food additive, herbicide, fungicide, you name it. We are polluting our water, we are polluting our air, we are polluting our food. Okay. How do we expect to be healthy? And unfortunately, nobody is trying to look into these, questions or answers. We just want a pill for an ill and we think everything going to be okay. It's not happening. With the pill, we could not solve diabetes. With the pill, we could not solve hypothyroidism. With the pill, we cannot solve IBS. You name any one problem which is solved with the pill except the fever, and that fever was healthy for the body. And when you take up antipyretic, you expose yourself to more problems in the future. So imagine the pill story is not working. Emergency medicine is fine when it is required, but if we have to keep our bodies healthy, our child's body healthy, we have to improve our child, we have to do much more than that. The basic fundamentals that is set by the nature. Nothing new I'm asking for, basic fundamentals. So I think for today, I'll stop my presentation here. Tomorrow we'll get into more detail, okay, about specific behaviors and why it happens, what are the different reasons. And of course, tomorrow I will talk about the solution and how we can help you. So now we will open up to your questions. If you can raise your hands.
Please raise your digital hand. We'll take your questions one by one. You can unmute now.
Sir, good evening, sir. Hello, sir. Good evening. Am I audible to you, sir?
Yes, Mr. Tejas, you can go on. Yes.
Yeah, my child is 3 years, 3 months girl baby, sir. Actually, at the age of 1 year, 2 months, she was so all right. Easy to talk, easy to respond, easy to communicate. But slowly, from 1.5 to 2 years, we noticed that now she's not giving eye contact, and she can now also she able to speak very nice. She's very communicative. But whenever she needs them, the time only she's talking. But if we ask, she don't respond. If we call, she won't respond. She won't tell her name. And poor eye contact. What we can understand about this child?
Okay. So I am not in this presentation, I'm not going to conclude anything. All I'm trying to say is, if a child is not behaving the right way, as a child should have been behaving, as a child should have been developing, if something is gone wrong, there has to be a reason behind that problem. We should be looking at finding the reason and solving the reason so that child can recover once again and start behaving as the normal age.
Is it right age for 3 years, 3 months to give NET?
Sorry?
Is it right age 3 years, 3 months?
Earlier it is better. It is. Yes, absolutely. It's the right age.
Yeah, thanks, sir. I will come back to you.
Gita, please go on. You can ask a question now.
Hello, sir. This is Mitesh here. Sir, my daughter is 6 years old. She started going to the school now, but she's having trouble in writing and communicating with other kids in the school, and often she shows a little aggression while going to new places.
Okay. So what is your question, Nitesh?
My question is, sir, she's having troubles in writing and
I understand the problem. No, I understand the problem, Nitesh. What is the question you want to ask? I am saying if a child is having trouble in writing, communicating, or aggression, there has to be a reason behind it. It is just not a behavioral problem. I am proposing that let's look beyond the conventional way of looking at the problem. Let's see what are the reasons behind it. Aggression, there has to be reason. Not able to write properly, there has to be reason. We need to know that reason and solve that. As a consequence, writing will improve, aggression will improve, communication will improve, empathy, sympathy will also improve.
Right, sir.
Hello, good evening, sir.
Yes, good evening, sir.
Sir, let me know. I just introduce myself. This is Roshan this side. My child is just 4 years old, and at the age of 2 years old, he was just normal. And after that, I just left the India and go abroad for work. And suddenly he start like hyperactivities, and eye contact completely zero. And nowadays I am doing the treatment like physio. Is it helpful to treat to cure this disease?
Okay, physiotherapy is for the muscles. It's an external therapy.
No, not only physiotherapy. That is oral therapy and speech delay also, speech therapy also. Is it helpful?
Roshan, you have to either you allow me to finish or you tell something which is complete. You mentioned physio, you ask, is it complete? I was just trying to answer you, and you tell me the complete picture.
Sorry.
Roshan, you're saying you're doing physiotherapy for your child, oral therapy, for physiotherapy. That's also for the muscles only, right?
Oral therapy, like that there is a center. There is a like they are just doing like we can do the cure the autism.
Did you hear the presentation, or you just came in just now?
No. Actually, I'm just late.
All
I
right.
just joined after within 10 minutes ago.
Best that you go through the presentation that I made.
Can you share me the presentation, sir?
It will be shared.
वो recording सब share करी जाएगी सर, उसकी problem नहीं है. बाकी इसमें मोटे तौर पे ये है कि आपके जो सिम्टम्स है बच्चे के, जो पैटर्न्स है, उसके हिसाब से कुछ टेस्टिंग करते हैं हम, पूरी बॉडी को ट्रीट करने की कोशिश करते हैं. अगर वो हम कर पाते हैं तो जाहिर सी बात है बच्चे की बॉडी इनेबल होगी, रोड ब्लॉक्स हटेंगे तो दिमाग के अलग अलग सेंटर्स डेवलप होंगे, न्यूरॉन्स के कनेक्शन डेवलप होंगे. तो चाहे वो बच्चे का प्यार से माता पिता को देख पाना हो, या बातें कर पाना हो, या सोशल बिहेवियर हो, सभी में इम्प्रूवमेंट आना लाजमी है. तो आप एक बार ये रिकॉर्डिंग सुनिएगा, ग्रुप में शेयर करी जाएगी, और कल भी जरूर ज्वाइन करिएगा. और रात इस समय भी थोड़ा समय रुके रहिए, आपको बहुत सारे लोगों की बहुत सारी बातें, सवाल जवाब से काफी कुछ समझ में आएगा, और उसके बाद में दोबारा पूछिएगा.
Okay, sir. Thank you, sir.
Miss Nikita, please go ahead, ma'am. Ask your question.
Excuse me, sir. Will it work for 16 years old child?
Yes, of course, ma'am.
Okay.
It will. Acha, we'll try to go by the sequence in which I have mentioned in the group chat also. So, Miss Nikita Seelan, are you there, ma'am? If you can unmute yourself, ask your question.
I just wanted to know if the document will be shared, sir.
Yeah, it will be shared. The recording itself will be shared. The PDF will not be shared, but the recording would be shared.
Okay. Thank you.
Mr. Kiran Kumar Verma, please go ahead.
Yes, sir. Right. Yeah, I am audible.
Yes.
Yeah, sir. I have two questions. First question is that just 10 days back, I came to know about my 3-year-old kid that is having autism or some analysis and all. After that, I just start searching, Googling, you do everything. Means now I have first allopathic approach. Second one, I'm searching any homeopathy doctor. Now third, this internal medicines. So my question is that to whom we have to trust? Everybody is telling that this is the right thing you do. See, whole presentation I had listened very carefully. I got the point that you are not treating the symptoms, you are treating the causes. That I got your point. But for a 3-year kids, all these medicines are safe. These are only allopathic or Ayurvedic? And my second question is that, sir, I belong from Rajasthan, and I think you guys are from Bangalore. So if I want to carry on with you, then how come this distance traveling will be managed? Because our first priority is the treatment. That's it. Two
All right.
questions.
Just first of all, Kiran, let's understand which treatment will work or not work. Any treatment that is targeting the root cause. Now, that target can happen in homeopathy, maybe, if the practitioner is deep enough to know that. Okay.
Okay.
Or functional medicine or anything. As long as they are working on all the reasons of the problem, then you can expect recovery. Okay?
Yes.
So it's okay, different people will say different things, but who is saying so much detailed thing to you? You have to choose that. Anyway, second is you don't have to come to Bangalore for treatment. You can be at your home. We'll arrange all the testing at your home so that we understand the root cause and accordingly we deliver your treatment at your home. Because it's a long way of this thing. We start with a 3 month, but then it needs much more time to recover. But as you keep every month and month you keep doing the treatment, you keep seeing more progress. Okay, but still it's a long journey. So you don't have to travel anywhere. The format in such a way that all of the parents can be home, but of course it's a hard work. You do it at home and then you will see recovery.
Yeah, sir, one more thing. Just 10 days back, I came to know about my kid. Then, and I think you are from Bangalore. So, is there any specific clinic and you are telling that you had cured 1600 odd people, the kids? Then, any means references, means every kid have a different symptoms.
Kiran,
So,
I did not say we cured 16,
yeah,
we
I'm
worked
sorry,
with
sir. Yeah.
1600.
Yeah.
Out of that, parents who continued with the journey, 2030 are no more labeled with the problem. That is what we are saying. But all of them, month on month, they're improving. Now, the journey can take 1 year, the journey can take 1.5 years. How many parents would like to continue journey is one thing, but any child worked with us where parent had followed the recommendations of the food, diet, lifestyle, supplementation, whatever we are doing, within 3 months of the start of the program, 20 to 30 minimum, that is the recovery made. Of course, we continue till the time then we have a complete recovery. Now, safety, there's nothing unusual we are doing. Okay. If toxins are there in the child's body, it has to be eliminated. You cannot have toxin in child's body if lead is there, mercury is there, arsenic is there, barium is there, cadmium there. You want them to be out of your child's body. If your child has infections, you want the infections out of your child's body. If your child is deficit on certain things, you want those deficiencies to be covered. You want to feed the best of the food to your child. You don't want to feed kurkure. You don't want to feed lays and chips and all that to your child. You don't want colas and candies and cakes for your child, right? We are only doing what is necessary for your child. We're not medicating your child. We're just trying to create right conditions so your child can develop normally.
Thank you, sir.
Ms. Gargi, you had my advice to you, sir, would be to stick around and listen to various questions and answers for different parents.
Yeah, hi, sir. So my question is, I would like to know what are the conditions, like suppose if I give MB12 to my child and he becomes really hyper out of control for 5-6 hours, So what can be the conditions? Because people say that you have to give MB12. You have to stay for some 1 month, but he might be having some MTHFR or other mitochondria. I just want to know from your perspective, what can be the conditions needs this child to become so much hyper with MB12?
See, hypermethylation is also a problem. Okay. This B1, B2, B3, B5, B6, B6, B7, B8, B9, B12.
Right.
As a part of the B complex, all these the things required. Can only B12 solve the problem?
Well, yeah, got your point, because people say that folate is more easily absorbed, right?
Who are the people? Have they checked the folate levels? They're rock bottom. They're lesser than the B12. Okay, so I'm saying, Gargi, different people, they say different things. If some person tells you do only one thing and it's a solution, I am certain that they don't know what they're saying. Okay, I start with the light and the water and the food and the microbiome, infections, heavy metals, nutrition, liver function, thyroid function, electromagnetic fields, so many things which could be affecting. Can only B12 fix the problem? Yes,
No.
B12 is required. It's important.
Yeah.
I'm not saying it's not important.
Right.
It's much more deep and much more comprehensive solution is required. It's a very complex problem, by the way. Okay, it can be recovered, it can be resolved, but it's a much more complex and needs a much more comprehensive planning.
Yeah, but in your experience, like you might have seen many kids, right, becoming really hyper on B12 supplements.
It's a hypermethylation idea. That's what I'm saying. Hypermethylation.
Right. But I was like, I took it myself and nothing happened to me. So just a pinch of powder, I'm just surprised, like something must be wrong with my child's body, right? Like it made him so hyper.
Let's understand
for 5-6 hours.
There's so many nuances going on at a given point of time. Now, when you take B complex, let's say, or B12 also, the immune system also gets a little better. When your immune system gets a little better, it fights the infection, which is the problem. When infections are fought, these microorganisms, which are deadly pathogenic to our human body, they die. When they die, they release a lot of toxic waste in the blood. That is called a die-off reaction.
Yeah, but it didn't seem to me like a die-off reaction. I did some other medications too, but I got your point. Might be. Yeah.
So, Raji, either you decide yourself or you take my
yeah, definitely. Obviously, that's the reason why I'm in this platform today. Yeah.
So I'm saying it's a much more complex problem. Okay, I'm not only dealing with children. We deal with various other problems also. That enabled us to understand a lot more about the disease and the processes and what works, what doesn't work, and all that. And how do we sustainably fix the problem rather than giving quick fixes to this and that.
Right.
Miss Millie, please go ahead.
Thanks, sir.
Millie Agarwal, are you there, ma'am?
Hello, am I audible?
Yes.
Okay, so I have a daughter who is 7 years old, and I've tried many therapies like occupational therapy and behavioral therapy. For many years, I've tried this, and there was not many results. I could not see many results coming out of it, and I'm not sure what I should do next. So, do you have any advice to that?
Millie, I think you did not hear what I had started the presentation with. Again, I'm repeating for the benefit of other parents also. It's an internal problem, body's internal problem. Because of that, the child is having certain behaviors. Now, that internal problem can be a chronic infection. That internal problem can be lack of healthy microbes. Can internal problem heavy metals, nutrition, poor liver function, poor thyroid function, electromagnetic fields from human-made electronic gadgets. Okay, like that, dehydration, poor quality food, high sugars, Okay. Now you're trying to solve an internal problem with the external therapy. Can you expect the result really? Now what you need to be doing, you need to be looking into the problem, why your child is hyperactive, and you try to resolve the internal problem.
Yeah. Okay, thank you.
Miss Manali, please go ahead.
Hi, good evening. Am I audible?
Yes.
Hello.
Yes, madam.
Thank you. Sir, what I exactly agree with you is the internal problem. Like my daughter is a little sugar addicted. Like she gets sugar rush. She's 7 years old and she's been recently detected with ADHD problem. What she is unable to refrain from is chocolates and cookies, and also sometimes she craves for chips. So the thing is, like, we are trying to cut down as much as possible. What is unable to be catered to her is she's not finding interested to any other food which doesn't contain sugar. So what exactly can be a substitute, because she is under ADHD. Otherwise, she's a completely normal child. She's doing school. She's very verbally strong. When it comes to writing, she has a problem. Like she's unable to copy from board, and even if she's copying, she's not maintaining a proper line and all that. So I completely understand that sugar is something that is actually causing. Now, I being a working mother, I'm unable to keep a check because she's being raised by a nanny and my parents and grandparents, as you know, like no matter how much I tell them, उन लोगों का लाड प्यार and all that comes into the picture. So is there any substitute like dates or maybe honey or something like that that can be changed so that she finds it interesting to eat?
Right. So, Manali, and unfortunately, solution is not so simple and straightforward. Okay. Yes, you can use stevia. Yes, you can use coconut sugar, monk fruit sugar, and all that. It still can be a problem. Yeah, problem might reduce. Still can be a problem. Now you see, infections are a problem. You said she gets a sugar rash. Rash means
not rash, sir. I mentioned rush. Like maybe she's sitting down somewhere quietly, she's doing something. Suddenly she craves for a chocolate, and she needs that exactly at that point of time. If not a chocolate, something like a biscuit or something sweet.
I understand. All I'm saying, until you resolve that infection which is triggering the child to eat a lot of sugar, the cravings will not go. Cravings is not because child want to eat. It's an infection, especially the fungal infection, which is controlling the mind, which is asking the child to go look for sugars, go look for candies and colas and cookies and all that. Okay. Idea is you clean up the diet, you clean up the infections, you reinstall healthy microbes, your child will be all well, ADHD will be gone. But then if we don't take it seriously, probably it's not easy problem. And then as her age is increasing, things will become more tougher.
The problem I'm seeing in her is, sir, she is verbally strong. She's writing everything in my presence. Every time she's at school, she's in an exposure. She's getting distracted. She's getting blank. Maybe I've prepared her with a rhyme or a poem or the lesson of that day. I know she has responded to me. She's writing it properly at home. At school, I don't know, something distracts her. She's completely blank. She'll just sit at a corner. She'll not mix around. Even if she's mixing around, the communication level with the other children of her age is not matching. So she's unable to make friends there.
Right, Manali, you start with this problem and you know the answer also. But let me again help you understand our ability of the brain, how well it understands, communicates, or make mathematics and all that, how well the cells are functioning, how well the mitochondria is functioning within each cell, that will decide our abilities. Now, if I poison my mitochondria with a lot of metabolites of the fungus, one of them could be alcohol. If I poison myself with alcohol, will I be communicating with a lot of people, or will I be just sitting alone? Will I get blank, or will I be very, very, enlightened?
No, right.
You eat sugars, you convert the sugar into alcohol, which is one of the metabolites, and you poison your brain with the alcohol. This is called microbrewery syndrome. Okay. So you have to cut down, even forget about the sugars. You have to cut down white rice. You have to cut down fruits also, the sweet fruits, to improve her situation. It's very, very possible, but of course it needs effort.
Right. Thank you so much.
Ms. Shiva, please go ahead, ma'am. Ms. Shiva Ali, are you there, ma'am? Ms. Shiva Ali, are you there? Okay, we'll come back. Mr. Varun, please go ahead. Mr. Varun Sikri. Mr. Varun Sikri, okay. Mr. Sumit Saw, yeah.
Yes. Yeah. Well, thank you so much for the presentation. I have got 4 quick questions. Probably I'll ask them in sequence. And yeah. So the first question is, how is the assessment done? Is it questionnaire-based assessment or medical test? Hello. Yeah. My next question is, are the medicines allopathic or Ayurvedic or combination? That's my second question. Third question is, how frequently the blood tests or assessment done to verify the progress, or how frequently will the parents have the assessment call? And last question is, will stimulants or steroids, which are harmful in long run, will they be used as medicines in this treatment? So these are my 4 questions.
Right. So we will collect physical problem the child is facing through a document. We'll give a questionnaire to the parent. Plus, we'll collect a lot of markers, infection markers, liver function, thyroid function, lipid profile, mitochondrial function assessment. So metabolic profile for that, heavy metals. Okay, we will have a lot of biomarkers to know, and then correlate the biomarkers with the actual physical problem the child is facing. Every 3 months we will be doing it.
Perfect.
Then we will not be using steroids or any other drug to suppress the problem. That is not even our goal. Our goal is to see what is causing the problem and how do we fix the problem. Now, it will be a combination of primarily supplements or little bit of infection control or probiotics, combination of things. What is found on the test? If infections are found, we might introduce a little bit of allopathy, that too very, very safely.
Perfect.
So very, very safe way we will be doing this thing.
Okay, great. Thank you so much for answering my question.
Ms. Shiva, please go ahead.
Hello, sir.
Ji, बताएं.
Sir, my son is 4 years old. He is not speaking properly. His speech is delayed, and now he is in school. Whenever I talk with him, his doctor has oh my God.
आप कंफर्टेबली हिंदी में बात कर सकते हैं, संकोच ना करें. आपकी आवाज नहीं आ रही है सर, दोबारा से जब ये आती है तो आप ज्वाइन करिएगा. मिस्टर वरुण, प्लीज गो अहेड.
Sir, good evening. Hello, am I audible?
Yes.
Yeah, good evening, sir. My question is that to some child, in this case, therapies can be harmful or can be regressive. Another thing is it right to send these kids to school, the regular school? Or should we try to learn them something like pottery training, or teaching them something at home is right or not? Or let them be free and let them have the passive learning that we usually do, the normal kids do?
So first thing is a very important question, Varun, and it's difficult to answer also when therapies can be negative. Now, I don't know really, but let me give you my understanding. Now, again, this is not a very valid this thing, but I'll still tell you. If my body has to heal, I should be at rest. I should be at peace. I should not be stressed out. Okay? It's a fundamental. My parasympathetic system should be active. My sympathetic should be calmed down. Now, when I have a problem, I go to a therapy center. I've been asked to repeat. I don't even know what they're saying. I don't even understand what they're saying. I'm just being asked to repeat. Try this, say this. I might get stressed out. Okay, I might be worried. What is this happening? I don't know what I did. See, I'm a child of 30 years grades school. You put me onto a medical school. Will I get stressed out?
Yeah, sure, sir.
So then, hope that gives you some clue that whether it's good or bad. Not that I'm
Sure.
against it. Okay.
Can I share a viewpoint with other parents also, if you allow?
Yeah. Yes. Absolutely.
Yeah, I request all parents, each and every person who is listening to me, please observe your kids closely. What a parent can do, a therapist or a doctor can't do. We are with our child for throughout the day. आप उनको बहुत क्लोजली ऑब्जर्व कीजिए व्हाट दे आर कंफर्टेबल विद. आज मेरे को 1.5 साल हो चुका है, मैंने अपने बच्चे की कोई थेरेपी नहीं कराई है एंड ही इज रिस्पॉन्डिंग वेरी वेल. जब हम उसको दिल्ली के बेस्ट सेंटर्स में, मैंने उसको 3 जगह शिफ्ट किया एक महीने के नोटिस पे. जब मुझे नहीं समझ आया दैट कि तब क्वेश्चन ये होता था बच्चे के साथ प्रॉब्लम है या थेरेपिस्ट के साथ प्रॉब्लम है. प्रॉब्लम किसी के साथ नहीं है. मेरे बच्चे के केस में मैंने वहां देखा है देयर आर किड्स हु आर रिस्पॉन्डिंग टू थेरेपी, वो लर्न करते हैं. बट मैं सर की बात से एग्री करता हूँ. आप यू कैन सी 6 months डाउन द लाइन दे किड्स आर एक्चुअली रोबोटिक. आई एम वेरी सॉरी टू से, आई अपोलोजाइज, दे टर्न अ बिट रोबोटिक. वो सिर्फ उस चीज को रिस्पॉन्ड करते हैं जो उनको सिखाया जाता है. वो एक न्यूट्रल लर्निंग मैंने नहीं एक्सपीरियंस की. मैंने 3 महीने अलग अलग जगह ट्राई करने के बाद अपने बच्चे की थेरेपीज बंद की, क्योंकि मेरे बच्चे ने जब बोलना शुरू किया, ही वाज अराउंड 11 months उसने स्टार्ट किया, 18 months उसका रिस्पॉन्स कम हुआ, वी स्टार्टेड गोइंग फॉर थेरेपीज. तो थेरेपी से जाने पे वो जो बोलता था वो भी बंद हो गया. एंड दिस हैपेंड ट्वाइस एट द गैप ऑफ कोरोना लॉकडाउन. फर्स्ट लॉकडाउन के बाद में गया तो रिस्पॉन्स बंद हुआ. सेकेंड लॉकडाउन में उसने घर पे बोलना शुरू किया. मैंने लॉकडाउन खत्म होने में फिर गया इस उम्मीद से कि इम्प्रूव होगा, बट वो रिवर्स हुआ हर बार. तो दिस इज माय पर्सनल ओपिनियन कि मेरे बच्चे के साथ थेरेपीज ने काम नहीं किया. हाँ, उसको फ्री छोड़ने पे और उसके डाइट को बैलेंस करने ने काफी हेल्प किया हमें 1 साल में. मैं सर की अप्रोच से 100% एग्री करता हूँ. बी का पेरेंट एज ऑफ नाउ एक हम होम्योपैथिक डॉक्टर को फॉलो कर रहे हैं जिनका अप्रोच सिमिलर है. सर का थोड़ा वास्ट है और डिटेल्ड है. सेकंड क्वेश्चन इज सर कि स्कूल भेजना चाहिए या नहीं भेजना चाहिए.
वरुण जी, आई थिंक आप काफी समझदार हो. अगर बच्चे की क्षमता है वो करने की तो भेजना चाहिए. अगर क्षमता के बियॉन्ड लग रहा है वो जो करेंगे तो मुझे लगता है कि पहले हील कर लीजिए फिर भेज दीजिएगा. पिकअप जितना भी थोड़ा लैग रहेगा वो बच्चा पिकअप कर लेगा.
ओके, थैंक यू वेरी मच सर. थैंक यू वेरी मच.
शिवा जी, अभी आप हो तो आप बोल सकते हो.
सर मैं अब हूँ सर. मैं जम्मू एंड कश्मीर से बोल रहा हूँ सर.
ओके.
जम्मू एंड कश्मीर से मैं बोल रहा हूँ सर. मेरा बेटा जो है 4 साल का हुआ है. तो सर मैंने बहुत सा पीरियडिक कंसल्टेशन ली. उसको थोड़ी ये प्रॉब्लम हो गई थी स्पीच डिले की. 3 साल तक वो बिल्कुल मम्मा पापा वगैरह यही बस बात करता था. मतलब फुल सेंटेंसेस वो यूज नहीं करता था. फुल सेंटेंस मतलब 3 word जंप या 4 word जंप वो नहीं कर पाता था. फिर मैंने उनको मतलब थेरेपीज भी दी, स्पीच भी दी, ओटी भी दी. तो उससे बहुत कम फर्क पड़ा बिल्कुल. अब जब मार्च के महीने में मुझे बताया गया कि आप उसे स्कूलिंग के लिए भेज दो. एक फ्रेंड ने मुझे सजेस्ट किया कि बोला आप इसको स्कूल में. जो ही मैंने उसको स्कूल में उसका एडमिशन किया तो उनको बोला वहाँ पे कि इसको स्पेशल केयर की क्लासेस वहाँ पे उनको देते हैं. तब से वो जंप कर रहा है. अब मतलब अब वो 3 word 4 word और वो अच्छे से रेस्पॉन्स भी कर रहा है. मगर उसको इकोलिया की प्रॉब्लम हो गई है. कोई सेंटेंस वो रिपीट करता है. तो सर आप कुछ सजेस्ट उस बारे में कुछ करें. कोई ट्रीटमेंट होगा या कुछ.
शिवा जी, वही हमने बात किया है कि इन बच्चों में काफी सारी तकलीफें होती हैं. खाने से लेके लाइट से लेके उनके अंदर का टॉक्सिसिटी, इन्फेक्शन, वो सब कंट्रीब्यूटिंग फैक्टर हैं जिससे बच्चा रिपीटेटिवनेस, स्पीच का डिले, मसल कमजोर, राइटिंग का एबिलिटी कमजोर, वो सब रहता है. लेकिन हर बच्चे में हो सकता है डिफरेंट, हर किसी में डिफरेंट लेवल का प्रॉब्लम हो. उसको टेस्ट करना पड़ेगा, जानना पड़ेगा, समझना पड़ेगा, उसके हिसाब से उनका ट्रीटमेंट करना पड़ेगा. ट्रीटमेंट माने तो उनके प्रॉब्लम को सॉल्व करना है, सिम्टम अपने से सॉल्व हो जाता है,
जी
बॉडी को जानती है बॉडी को कैसे रिपेयर करना है, बस अपने को उनका राइट कंडीशंस बनाना है, दैट्स ऑल।
जी सर। तो सर मतलब इसके लिए जो ट्रीटमेंट या टेस्ट जो होते हैं वो किस
कल
तरह
हम
से?
डिटेल में डिस्कस करेंगे सर, आप कल जरूर ज्वाइन कीजिए।
ठीक है सर।
स्वाति जी, प्लीज गो अहेड मैम, स्वाति श्रीवास्तव।
Good evening, sir. Sir, actually, hello.
Yes, ma'am.
Yeah, can I speak? So, sir, my question is, what will be the scope of improvement in a 5-year-old? My child is turning 5 years soon. So, what will be the scope in him? And another is like at the therapy centers, he is giving proper attention to the therapist and all while doing activities and all. But when at home, he is looking here and there. He is very much distracted. So could you suggest something for that? And third is like, what are these medicines? Like, it would be allopathic or it would be diet, or what kind of approaches this have? And just yes, sir, only this much.
So I think first question is कितना scope है 5 साल का बच्चा? I would say 100% scope है. Okay. There's every possibility for the child. Second is किस तरह का medicine है? Like multiple time explained, हवा से लेके, पानी से लेके, लाइट से लेके, खाना से लेके, माइक्रोबायोम से लेके, heavy metals, infections, multiple triggering factors which could be causing the symptoms. We need to look into that, and accordingly we have to fix the situation. Allopathy है कि क्या है? Mostly nutraceuticals, mostly naturopathy. Okay. A little bit of a here and there if required, depends on chelation चाहिए क्या चाहिए उसके हिसाब से थोड़ा बहुत variation हो, but in a very very safe way.
Miss Pramila, please go next. Mr. Sia, just one, the guy, the person has to leave. So Pramila, would you like to go next? Pramila Kulkarni.
That is okay. I will ask tomorrow. Actually, I have to sit my child down for dinner. So it's already half an hour late than this time. So I'll ask my questions tomorrow. Thank you so much.
Okay, Mr. CR, please go ahead.
Okay, sir, just two things. आपका बहुत ही होलिस्टिक अप्रोच लगा, राइट? सो दैट इज अ वंडरफुल थिंग. अभी मेरे सन को हमने होम्योपैथी चालू किया है. द डॉक्टर देयर आल्सो इज गोइंग इन द सेम डायरेक्शन. वो डाइट एंड ऑल पे नहीं फोकस कर रहे हैं, बट वही है रूट कॉज पे. तो हमें इम्प्रूवमेंट भी दिखाई दिया है. तो जो भी फंक्शनल मेडिसिन अप्रोच एंड ऑल रहेगा, विल इट वर्क with the homeopathy that we are taking? That is the question number one. And second, sir, virtual autism, I think corona wale period में mobile phone या TV बहुत हो गया था. What we can, connect the dots in our cases, that is might be screen time बहुत ज़्यादा हो गया था, and उसी time थोड़ा सा शायद MMR vaccine हुआ, so we don't know. But अगर आप virtual autism पे भी थोड़ा सा, light डाले, जैसे आपने बहुत सारे aspect पे डाली थी, तो we parents can get an idea कि यार क्या है क्या नहीं है. हमने जब से बंद किया है टीवी एंड ऑल, बहुत इंप्रूवमेंट है. और जब से हमको पता चला तो हम लोगों ने टीवी टाइम स्क्रीन टाइम 0 ही रखा है. ओके, सो दैट इज 1 year एंड होम्योपैथी को 6 months है, तो हमें लग रहा है इंप्रूवमेंट काफी सारा. ओके, बट स्टिल थोड़ा हमने पढ़ा था कि गट का कनेक्शन होता है, और जो आपने बोला है वो सब सही लग रहा है. एक वर्चुअल ऑटिज्म पे इफ यू कैन थ्रो सम लाइट, एंड होम्योपैथी के साथ वो वर्क करेगा नहीं करेगा, जो आपका अप्रोच है वो सर. These two things.
So functional medicine has no contraindication of homeopathy, no problem. Homeopathy can go along. Second is potentially there could be two major driving factors of virtual autism. One is of course the screen time itself. Now there's two centers in the brain, left and right. One is more with the memory, one is more with the speech. Now when some child is always into the screens, they develop more memory. Their speech center is suppressed. So when you take it out, then they start developing the speech also. Second, of course, there's a screen that is emitting blue light. Blue light is toxic to the mitochondria. Then there's this machine also has electromagnetic fields. Now I am also sitting very close to my laptop. I am exposed to electromagnetic fields of my laptop. around the machine, any electronic gas. So that also, now every electromagnetic field, because the alternating current is fluctuating at a certain frequency, my mitochondria vibrates at a certain other frequency, when there's a mismatch. Okay, that damages the mitochondria. Now, when mitochondria is damaged in the brain or in the body, that leads to let's say disorder. So removing them and allowing the body to heal, getting the body to more natural electromagnetic fields will help get better.
Okay, sir. Just continuing with that. So, हमें हमारे मोबाइल फोन्स या iPads and all, जब हम सो रहे हैं या बच्चा साथ में, तो हमें भी साइड में रख लेनी चाहिए. वो भी थोड़ा बहुत हेल्प करेगा EMF में.
साइड कैसे, उस रूम में मत रखिए.
Okay. So जो भी हमारा अप्रोच होगा फंक्शनल मेडिसिन का, you will be guiding us with each and everything.
Yeah. So there will be two components of the treatment. Okay, first of all, parental education. जो भी मैं अभी बहुत शॉर्ट तरीके में बोल रहा हूँ, आपको डिटेल में समझना है ये सब चीज. जितना आप समझ पाओगे उतना आप बेहतर इंप्लीमेंट कर पाओगे. सेकेंड, ऑफ कोर्स, ट्रीटमेंट वी विल टेस्ट द चाइल्ड वेरी थॉरली एंड कम अप विद द प्लान. लेकिन मोर इम्पोर्टेंट द प्लान इज द पेरेंटल एजुकेशन. अगर आप समझ ही नहीं पाओगे मैं क्या कह रहा हूँ, मैं किस भाषा में बोल रहा हूँ, then it will be very difficult to follow up and to stick to the plan. So this is more than the treatment is the education of a parent. प्रॉब्लम कहाँ से आया और उसको कैसे कैसे स्टेप बाय तरीके से सॉल्व करना है, तो वो हम दोनों चीज करेंगे.
Okay, in 1-to-1 sessions, right?
नहीं, parental education can only be done in a group, sir. I cannot. It's hours of interactions. It has to happen. I cannot spend so many hours with one parent only.
Okay. Thank you, sir.
Thank you.
Lakshmi, please go ahead. Miss Lakshmi, yes, are you there, ma'am? Yeah, go ahead.
Am I audible?
Yes.
Yeah. Thank you. And I got answers for most of the questions. And my the only question is, like, I recently started with some medication. So shall I continue along with this medication if I opt for this?
So medication, I don't know which medication. Let's say it's a allopathic medicine. Now, allopathy medicines are for emergency use, symptomatic relief. Okay. Now, our approach is to solve the problem. Now, symptomatic relief is required till the problem is resolved. Okay. You can certainly continue as the need of the drug would come down, as the child is settling down. Let's say there's a drug for hyperactivity, risperidone, for example. Now, if child is not settling hyperactive, you need risperidone so that your life and child's life is easy. But then you slowly find that your child is no more requiring it. You can taper it off with the consultation with your psychiatrist or psychologist or whosoever is treating doctor.
Right. I hope it is answered. Proceeding further, Ms. Wamshi, please go ahead.
Thank you. Thank you, sir. I think, I have a 4.5 years old son, diagnosed with autistic around 2 years. I think same story as most of the others here. I've been actually trying to go through the whole human anatomy, physiology, trying to understand how things work, and go to each specialist and talk about exactly that, what you're talking about, like what is the root cause. And I haven't got a lot of help, and I'm glad that I found functional medicine, which is doing exactly what I've been actually trying to do for the last 1.5 years or so. This is great. I've done a lot of research, so probably I know exactly what you're talking about, so I don't have any medical related questions because I know the path you're going, which is great. I wanted to pick your brain on a few things. Like, one is why I couldn't join the dots for a few of the things. Why do you think the regression is happening just around 18 months to 2 years, where the MMR vaccine could have been done 9 months or 1 year, or probably 6 months, or 6 months age of the child? Why do you think most of the regression does happen around 18 months to 2 years?
It's a difficult question. I really don't understand, but I'll try to attempt. Now, more we disrupt the biology, then symptoms start appearing. Okay. Now, what the infections I'm talking about, the toxicities I'm talking, you and me might also be having those things. But the severity of these things are much, much more higher in the child with a problem.
Yeah.
Okay. The first dose, one shot, less severity. Probably it is not enough to disrupt the biology. Okay. Immune system got some shock, but not enough to disrupt the system. But second dose, probably more potent. And see, one more thing to understand: the vaccines, lot of unknown things are there. It might be coming with the same name, same thingy, okay, but you don't know. So a lot of unknown things are there. I mean, I'm getting into territory which I should not even, or try not even attempt to touch that. But fact is, you know, the lot of unknowns are there, and then we don't know how it is. We have been told that the COVID vaccine will protect us, and still, you know, we are still much more risk of the problem. So.
Who didn't do more harm than what is done good. So yeah, I've been actually trying to talk to different parents from different countries just to understand, but the pattern has been the same. It's like, you know, different times of vaccination, but the regression is exactly the same. It's like I couldn't join the dots, so I thought I'll pick your opinion. The second thing that I wanted to ask is, I couldn't get that answer as well. It's like, it's actually affecting more boys than girls. I don't see why it's affecting more boys than girls.
Yes, yes. So there's a genetic SNP is there, which is more prominent in the males than in the females. So SNPs are a single nucleotide polymorphism, okay, not the complete anomaly, but that is more prevalent in boys. So it's like, you know, some of the genes are not 100% working. They might be working 40%, 20%, 60%. Now, when these genes, some of these are not 100% working, then amount of toxicity and amount of problem increases, then they start showing a problem.
Right. Okay. So probably around one chromosome, which is X and Y, which is where the things are acting more on boys than girls, I guess.
Yes. Yes.
Yeah. Cool. So I've been actually struggling to get the different tests because when I was going to specialists, like, you know, I go to gastroenterologists and say, you know, what can I get the SIBO test? And I get difficult answers saying, you know what, we can't actually do that when the boy is about this specific age. And when I talk about the microbiome, the whole microbiome test, so just to see if the balance of different bacterium is there, and then he says, no, there's no such test in India. You'll have to actually go to foreign. So all of these difficult answers that I've been actually getting. So how does functional medicine in India? This was like, you know, do we have enough technologies in India to cover all the tests that we really want to? And I understand that you want to actually just cover all the different tests, understand the constitution of a person or a child, and then see where he's lacking, and then change the whole environment to fix it itself.
So in India, we have enough tests available, but in some cases, if at all required, we might send a sample to US, we might send a sample to Europe also. So testing is not at all a problem. We have enough ways to doing it.
Right. Next question is like, you know, my kids were born outside India. What if you actually have to go back? Would you be able to actually continue having your support on that and continue to have probably the local medicines there, if not from India?
So yes, we have actually a lot of children working with us outside, some of them in UK, some of them in US, some of them in Canada, some of them in Saudi, some of them in Lanka. So that's not a problem. Yes, there's some, you know, it's not as smooth as somebody in India, but still we work a way around and give you a solution.
Coming to epigenetics, so basically I've been actually recently started learning a lot about epigenetics and try to understand how things work. It's quite amazing how it actually changes the gene expressions and stuff. So do you think, again, trying to pick your brain on that, I really wanted to talk to an intellectual who understands where I'm coming from. So do you think an Indian lady giving a birth in a foreign country would have actually contributed, if not the whole reason caused autism, but would have actually contributed to the fact? Sorry if I'm actually asking.
No, it's a right question. Now, you see, I'm from Punjab. I'm supposed to be in that geography. I'm supposed to be in those electromagnetic fields naturally by the earth. Somebody born in Africa should be in Africa. Now, a lot of people in COVID, most of them who died in America, they were blacks because they were not supposed to be in that cold environment.
Yep.
Okay. Whether because the birth in that land or the child in that geography, we don't know. But then certainly we Indians are supposed to be in different climate, electromagnetic fields. When we shift, see, a lot of people in Bangalore, they get asthma, allergies. I'm also suffering. My wife, when she's here, she has some trouble. She goes to Siliguri, which is her hometown. She's all well. There's no problem with her. So certainly that kind of geography we are supposed to be under. If we are not following, we might have more troubles. So MAO is the gene which is affected. Okay. So this is monoamine oxidase. That's a gene which is more affected in males, which is leading to more problems in boys.
Right. So,
interest of time, if we can proceed, Mr. Vamshi.
Sorry, yeah. I'll keep my questions for tomorrow. Sorry for taking too much time. Thanks.
Ms. Arunima, please go ahead.
Good evening, sir. Thank you for the session. It was very informative. I wanted to ask about can the genetic factors such as I'm a mother of a 2.5-year-old boy who has been recently diagnosed with red flags of autism, and I have a cousin, mama ki ladki jaise bolte hain. She is close to 30 now. She's suffering from global developmental delay. So, can genetics be a factor in my case? In my kid's case?
Hardly a factor. Hardly. Might be a factor, but it just
okay.
Just because your mama ki ladki has a problem does not mean that your child should have a problem. Even though there's a problem, she can also improve, your child can also improve.
Thank you, sir. And sir, I have, I mean, as a child, I had vitiligo. It came under control during my teen years, but is that also a contributing factor?
I don't want to blame the mother, but I can give you a little science behind that. Now, vitiligo is an autoimmune problem. Autoimmune problem means your microbiome, your own microbiome is disrupted, and mother gives the microbiome to the child. And microbiome disruption is one of the main reasons behind autism also.
So, sir, in this case, is there hope for improvement?
Certainly, there's a hope. That's why we are sitting in the half of the night discussing.
Okay, thank you, sir. That's all I had.
Mr. Rizwan, please go ahead next. Mr. Rizwan Pasha, you had a question.
Yeah, hi. I had a question. See, my son is 4.5 years old. Okay, so my son is 4.5 years old, and he's going to therapy classes, which is OT and speech therapy, for almost about 8 months now. So we as a parents, we have seen a lot of changes in him, but a few from I can say from about 1 month of time, instead of improving, where he's behaving in a different way, like he's being like example, he's being having a repeated sentence. He's getting hyperactive. Earlier he was not. He was getting hyperactive, and many things he keep repeating, and he's try to eat the nails. This is what few things which I have seen a recent changes in him. So this could be because of the hormone changes, or this could be because of the therapy, anything which needs to be corrected in therapy.
So, Mr. Rizwan, precisely what we talked about is that underlying problems, because of that child is having a behavioral issues, okay, as an outcome. Now, these underlying problems are dynamic in nature. They're not static. Just like a fever. If I get a fever, if I don't control the fever, infection will not go out of my body if I don't support my body. Now, my body is high on temperature. You temporarily somehow bring the temperature down. But if infection is not out, temperature can come back. Okay.
Correct.
So we are trying to fight some problem with some other tool, which is not, solving the problem. That is why a lot of time, a lot of people see some marginal changes for some time. After that, there's always a way, they come back to square one because the underlying problem is never solved. So is anything wrong with therapy? Probably they're trying their best. Nothing wrong with that. Okay, but underlying to the problem, what is the reason is never solved, which should be looked into and which should be solved.
Okay. Right, doctor.
Ms. Gwari, you had a question. Please go ahead next.
So my son is 7 years old now. When he was 3 years old, we noticed that he can't run like other kids. He just uses his hips to run, and he struggles in running. Now he is improved, but I feel that his feet looks like baby feet only compared to other kids. He's good at studies, and he's a very picky eater. And the beginning he had severe constipation. For that, I have put him laxative and Dulcolax suppository for daily for 1 year. And at when he was 1 year, till 1 year, I put for pan 20 for his reflex disease, GRD. Now he is good at studies, but he shows a lot of tantrums. Is this also development disorder, or what else it would be, sir?
Okay, now the main problem that you're saying is a tantrum, correct?
Not oftenly. Whenever he is hungry, that time he will be out of control. But when he is full, he act very nicely.
Right. So there are issues, right? There are behavioral issues. Okay,
He has. Yeah.
Now constipation is a major problem.
Now it has been solved, sir. After when he reached 4 years age, that time he solved. He is a very picky eater, sir. He doesn't like, suddenly he stopped eating all the fruits. Even in the beginning he used to like all the fruits till 2 years. After that, if he sees banana also, he can't go there, and he says very bad for all the fruits. He doesn't tolerate the smell of the fruit. All those things are happening, sir. And if I wear gagra and heavy jewelries, all those things, he is very sensitive for those all issues. If I wear sari also, he doesn't like. Some sensory issues.
Okay, so let's understand what is the sensory issues. What is the sensory issues? Your senses are not able to interpret what is information coming to the body, or not able to respond back to it because something wrong in the biology. Because of that is happening. Just because we name it sensory and we leave it, is that this thing you yourself said your child is taking everyday laxatives. The laxative means you are forcefully evacuating the gut. Probably there is no peristaltic.
Now he is not on the laxative, sir.
Okay, he's still a picky eater, right?
Yeah, he's a picky eater.
There has to be reason behind pickiness also.
Mm-hmm.
Okay, there's a biology problem also, right?
Okay, sir.
That has to be fixed.
Mm-hmm.
As a consequence, sensory issues will also come down. Aggressiveness will also come down. Tantrums during hunger. See, a lot of us can control hunger. Some of them are not able to control hunger. What is the problem?
Mm-hmm.
There's something wrong in the biology.
Okay, sir.
Right. So always try to see the patterns. Child is getting hungry, not able to control, showing symptoms. There has to be a reason. You fix that reason, child able. If other humans are able to do it, he will also should be able to do that.
Mm-hmm.
So we have to really go beyond what is the normal today. What I'm saying is not something very new, but in today's way things are happening, we go very, very superficial. You know, this happens, I take this pill. This happens, I take that pill. But I don't go beyond that. So I think, Gauri, what you need to do is try to support his, body with what it needs. I'm sure most of the problems that your child is facing will start going away.
Sure.
The sensory issues, so-called sensory issues.
Thank you, sir.
Miss Sana, please go ahead next.
गुड इवनिंग सर।
Miss Sana.
सर मेरा सवाल ये है कि मेरा लड़के की एज अभी 2.9 है। अभी हम लोग लास्ट ईयर से हम लोग थेरेपीज करा रहे हैं, काफी बहुत इम्प्रूवमेंट है, स्पीच बहुत अच्छी है, सब कुछ अंडरस्टैंडिंग, इंस्ट्रक्शन फॉलोइंग। बट प्रॉब्लम हम लोग क्या करें कि हमें मेडिसिन अभी थोड़े 2 मंथ से बंद कर दिए, तो अचानक से क्या हो गया, टैंट्रम्स, मेल्टडाउन्स, कहीं मैं क्राउड पे नहीं लेके जा सक रही बच्चे को, पूरा लाइक ही इज नॉट एट ऑल बिहेविंग एज अ नॉर्मल एट ऑल। एंड अभी थोड़ी दिन से पिकी ईटर हो गया बहुत कुछ, अगर मैं इधर डिस्ट्रैक्शन नहीं करूं तो खाएगा, या अदरवाइज पूरा थूकेगा, टंग पे भी रखूं थूकेगा, बिकॉज अदरवाइज ही लव्स फूड्स, एप्पल खाता था, सब खाता था, अभी सडनली पूरा स्टॉप हो गया। ही इज लाइक कंप्लीटली नॉट बिहेविंग लाइक अ नॉर्मल।
दवाई अब क्या दवाई दे रहे थे तुमको?
हम लोग दे रहे थे, रेस्पिट्रॉन दे रहे थे, राइसन दे रहे थे, वेबनी कार्नो एक्ट दे रहे थे, वेब्रिकॉर बोल के कुछ था, और बहुत सारे मेडिसिन थे। अभी मैग्नीशियम की कुछ एक दवा थी। अभी हम लोग क्या है, बिल्कुल नॉर्मल हो गया था। वी वेंट टू द डॉक्टर फॉर कंसल्टेशन, ही वाज आल्सो वेरी फाइन, ही वाज वेरी हैप्पी दैट योर चाइल्ड इज doing well. Now he is in nursery, he performs very well, he is has a good writing skills, learning skills, but thing is tantrums, biting others, hitting others, not at all sitting at one place, sitting near the gate at the school.
I get it. So I get that. Okay. All I'm saying,
Yeah.
you were giving risperidone, which is suppressant. आपको मालूम होगा suppressant है risperidone, है ना? आप suppressant का यूज कर रहे थे, वो ठीक से चल रहा था काम। लेकिन जो अंदर का डायनामिक्स है वो तो फिक्स नहीं हुआ कंप्लीटली। ऐसा है कि आपने प्रेशर कुकर लिया, नीचे तो आग चल रहा है, ऊपर से सीटी को दबा दिया कुछ समय के लिए, लेकिन जब आपने प्रेशर उठाया तब से वो विसल चालू हो गया। आपको प्रेशर कुकर को, उसका विसल को बंद करने की उसका आग को बंद करना पड़ेगा। अंदर क्या डायनामिक्स चल रहा है, क्या प्रॉब्लम चल रहा है, उसको सॉल्व करने पड़ेगा। Okay. Now, these symptomatic drugs are good to use for a short period of time till we fix the problem. किसी ने डायबिटीज हो गया, उन्होंने मेडिसिन मेटफॉर्मिन लिया, इंसुलिन सेंसिटिविटी बढ़ गया, ब्लड शुगर कंट्रोल आ गया, आपने मैं तो ठीक हो गया, मैं दवाई बंद कर देता हूँ। आप तो ठीक इसलिए थे क्योंकि दवाई चल रहा है, आपको ऐसा लग रहा है कि आप ठीक हो, आप एक्चुअली ठीक हो क्या?
तो मेरा ये भी क्वेश्चन है कि हम लोग कब तक दवाई ले, आखिर 1 साल भर से तो ले रहे थे, अभी लेंगे फिर 1 ईयर तक चलेगा, फिर स्टॉप करेंगे।
दवाई लेने के, मैंने एक बार भी कहा दवाई लेने के लिए, मैंने रेस्पिरेटोन का बात किया। मैं कह रहा हूँ कि अंदर कुछ प्रॉब्लम है, उसको सॉल्व करेंगे, जब सॉल्व हो जाएगा दवाई क्यों लेनी है?
हाँ, ओके, गॉट इट। एंड कंसंट्रेशन भी बराबर नहीं सर, ही नोज एवरीथिंग, बट बुला के पकड़ के बिठा के पूछना पड़ता।
ये सब बच्चों को ऐसे है, सब बहुत ब्रिलियंट बच्चे हैं, ये ऐसा नहीं है कि ये इनकेपेबल हैं, उनका बायोलॉजी ढंग से नहीं काम कर रहा है, इसके चलते नॉट एबल टू फोकस, नॉट एबल टू कंप्लीट देयर टास्क। वो सब स्मार्ट लोग हैं, अभी आयुष ने सबसे पहले वही तो दिखाया था कि ये तो एक्स्ट्रा स्मार्ट हैं, दीज आर स्पेशल बीइंग्स, बट उनको हम ढंग से रख नहीं पा रहे हैं। वी जस्ट हैव टू क्रिएट राइट कंडीशंस फॉर देम।
Yeah, and one more question, sir. He is fond of animals.
That's right. No, what is wrong with that?
नहीं, हर टाइम उसको सिटिंग टॉलरेंस पे एनिमल्स दिए तो he will sit, otherwise he won't sit.
That's okay. See, all of us, probably when you were a child, I was a child, Ayush was a child, all of us have some liking, dislikings, no? That is not a pathology. We have to fix the pathology. That is what I'm saying. Whatever is causing the problem, we fix it. Little liking, disliking, some this thing, that is nature of we being a child. Nothing wrong with that. That the child loves animals, or he He can focus when animals are shown to him. That's all right. But then
if I give one more question is, if I give him the animals in the morning, then throughout the day he will be like he will be telling the animal sounds throughout the day. Ba ba ma ma. That will be the routine entire day. So how should I stop this?
I don't know what are you looking for, Sana. I'm saying there's a pathology you need to fix. You're looking for one answer. Okay, you're looking for a pill. There's no pill for the problem. Okay, diabetes pill से नहीं ठीक होता है. मेडिकल साइंस भी बोलने लग गया आप ऑटिज्म ठीक करना चाहते हो, जब ADHD ठीक ASD ठीक करना चाहते पिल से नहीं होगा. कारण को देखना, मल्टीपल कारण हो सकते हैं. कितने बार मैं अभी इसी सेशन में बोल चुका हूँ. एक बार आपने रिकॉर्डिंग फिर से देख लीजिएगा.
एक्चुअली कई सारे सेंसेस बच्चों के एलिवेटेड होते हैं, तो उनका परसेप्शन वैसा नहीं है जैसा आपका होगा. जो जानवरों की आवाजें हैं या कुछ चीजों को टच करके जो फीलिंग होती है, उनको वो फीलिंग अलग तरह से होती है और वो उनको कंफर्टेबल लगती है, और उनको जो हाइपर सेंसिटिविटी है वो एक प्रॉब्लम है. जो इन्फॉर्मेशन उनके दिमाग तक पहुंच रही है उसको वो कैसे असेस कर रहे हैं और बाकी दुनिया क्या असेस कर रही है, उसमें जो डिफरेंस है वो प्रॉब्लम है. अगर वो डिफरेंसेस और परसेप्शन और उसको समझने की क्षमता में जो दिक्कतें आ रही है उनको अगर रिजॉल्व करते हैं, तो चाहे जानवर हो या कोई भी चीज हो, किसी भी तरह का कंफर्ट हो, ये कोई एक स्पेसिफिक इशू नहीं है. सब बच्चों का कंफर्ट कुछ अलग अलग एनवायरनमेंट से होता है. वो अपनी दुनिया खुद बनाते हैं और उस दुनिया में कंफर्टेबल रहते हैं. यही ऑटिज्म. अगर बहुत बेसिक लेवल पे समझा जाए तो सबकी अपनी दुनिया है और उस दुनिया के अंदर का जो कंफर्ट है वही उनकी सच्चाई है. और वो इसलिए है क्योंकि वो एक प्रोटेक्टिव शेल में रहना चाहते हैं. सब माता पिता का भी सारे लोगों का एक कोई किरदार है. यू गेटिंग माय पॉइंट. और इसका पीछे का कारण ये है कि इन्फेक्शंस हो सकते हैं, कुछ हार्मोन्स एंजाइम्स के इम्बैलेंसेस हो सकते हैं, जो डॉक्टर साहब समझाने की कोशिश कर रहे हैं. तो एक स्पेसिफिक इशू पर सबका बिहेवियर अलग होता है ना. तो जानवर का कोई रीजन होता है, ऐसा कुछ नहीं है. किसी का लाल मोजे का हो सकता है, तो उसका कोई अलग रीजन थोड़ा ना होगा. किसी तीसरे का साइकिल के थ्रू हो सकता है, किसी का चौथे का कुछ और, एंड ऑन एंड ऑन एंड ऑन एंड ऑन. तो वो कोई स्पेसिफिक इशू नहीं है मैम. उसके पीछे के कारण सॉल्व करेंगे तो ये प्रॉब्लम जाएगी.
Sure. Okay, sir. Thank you.
Mr. Balaji, please go ahead.
Yeah, thanks, doctor, for your time. So we are in this journey for a long time. My son is 15 years old. So we became verbal at the age of 5. So I just want to say one thing for the parents before I ask my question is it's a marathon, not a sprint. So have some patience and don't compare your child with others. So, sir, I have read a lot of research. So what I understand so far is autism, as you mentioned, it's both genetic and environment. My son also has a lot of constipation issues. We do try to treat it. And so I'm sold on this gut-brain connection. So I do believe there is a connection, and we have, he is on a gluten casein diet because we did some blood tests when we were in Bangalore. Right now, I'm not in Bangalore, I'm in Germany. So, but we found some casein and gluten allergy, and we just eliminated those kind of foods that shown some improvement in him. So my question to you, sir, like you've talked about like treating many children and so on and so forth. Is there any specific control study that you did, like a control group where you have tried your medicine and uncontrolled group where you have not tried your medicine, and you published any research articles, or is there any statistically significant results that you have found from your method?
No, sir. No, Balaji, I have not done any control study. I'm treating the children that are coming to us. I cannot deny the treatment. It's a very, very small group of practitioners. It's very difficult to run a clinical trial, and so many parameters are there. Even if I take this study to ICMR, they will refuse it because there's so many compounding factors. So all I can say, it's a very scientific, will only solve what is found to be on the test. And as a consequence, child is improving.
So having a control study, to answer you directly, we would love to have a control study, but then that requires a few $1 million. We don't have that kind of funding. We have to have sponsorship from a internationally recognized hospital chain. We would require different kinds of demographics to be catered to. We have to have a controlled environment which observes and controls their behavior 24/7 for at least 2 years, for at least 4 or 5 dozen families. get that kind of approvals from the families itself. So the whole thing will require many millions. Our estimate is anywhere between 25 to 30 million dollars. We don't have those kind of efforts. So that will unfortunately never happen. So Balaji, I think you are muted. So
Yeah. So thanks for your response. I mean, you have been very honest. So that was my only question. I do see a lot of significant improvements that you are causing, and you're trying to treat the cause. I really appreciate the efforts that you're doing. There are more professionals should come. I mean, I know that there are lack of professionals in this autism and doing research in this field, and I hope that what the methods that you're doing, it's being successful. I wish you all the best then.
Thank you, Balaji. Really appreciate that.
Ms. Varalakshmi, please go ahead. You had a question. Ms. Varalakshmi, are you there? Ms. P. Varalakshmi. Okay. Ms. Pranali, please go ahead. So Pranali is not there. Mr. Anurag, please go ahead, sir.
Yes, I'm Anurag Vishal. Can you listen me, sir? Am I audible?
Yes.
Yes. First of all, thank you very much, sir. This was very informative discussion. And as this is open session now for question and answers, so I have some 3-4 questions accumulated. First of all, my son is now 4 years, 11 months old. And with great difficulty, now it is happening to be 9 months. I have separated him with his mother. And presently, I am in service in Trivandrum, Kerala, and my wife and son is in Lucknow. And the son is taking the therapies, speech therapy, occupational therapies, behavioral therapies. But to our expectation, not much improvement we have noticed. However, some minor improvement we have noticed. And I was really surprised with the discussion, as sir has told me that root cause is being analyzed. However, some minor improvements I have noticed, like previously he was not able to identify colors, he was not able to jump on his own. So these things have been come as the improvement through this therapy. So what shall we do? Because this therapy is one of the most costliest affair for a service class person. So is it the message like, shall we stop the therapy or shall we continue with the therapy? That is the question number 1. Question number 2. Is the speech delay is only due to ASD or autism, or are there any other reasons also due to which this speech delay happens? Now, third question is, my son is very much obsessive towards a particular objects. If he is having some affinity towards, suppose nowadays he is very catchy with this belts what we are wearing on our trousers. So he will be like, anybody, even for the strangers also, he will on the street and he will try to grab their belts. So this obsessiveness towards a particular object, is it also the part of this ASD? Such type of behavior also, whether such type of kids are showing? Now question. Yes, sir, please answer this, then 2 more questions I will ask. Yeah.
Okay. So, Anurag, like Vishal Sikri has said, okay, if you as a parent has enough time with you to spend with your child, no better therapist than a parent. But then, if parents are occupied, probably then we need external support. But we are not against therapies. All we are saying that there's much more beyond therapies that is required to support the child. If you ask me what is the priority, first we fix the body, then we train the body. If body is unhealthy, doesn't matter how hard you train it, will again get sick.
Yeah.
Okay? So first we have to make the body healthy. That is this thing. Now obsession is again not uncommon in kids. Different kids have different kind of obsession. But one of the reasons that we have seen, they have multiple within the intestines, which is distorting the biochem and thereby obsession. As we clean up these things, obsession will come down or it will resolve also. So hope speech, you said, is autism or ASD. Actually, something is causing speech delay, and that same is causing autism, same is causing ASD, or autism is a part of ASD. Autism is not away from autism spectrum disorder. It is a much broader term, which includes autism, ADHD, and all that. So, which also includes speech delay, by the way, speech delay. So there are reasons behind all of these things. It's not that because of autism, speech delay, because something else is speech delay and autism. We need to fix that.
Fine, sir. Sir, my next question is, sir, how do we define this hyperactivity? Because being a parent, we are always in a denial mode that our son is hyperactive. But when we take him to some other public places, somebody starts saying that why he is not sitting on his place. Whether just not by sitting on his place, can we define him like, can we declare that he is hyperactive? What are the symptoms with that we conclude that he is hyperactive?
So, as a child, if not sitting, we cannot conclude that hyperactivity. There could be other things also associated with it. Okay, let's say child. Let's understand this. If child is doing these activity out of compulsion, okay, not sitting around, running around, always crying, always unhappy, always they're not happy or at ease within their body. So collectively, if we see these things, then we can call that hyperactivity is there. But just because child is not sitting around, probably. But then I am not so well versed with diagnosing the problem or quantifying the problem, because that's not what I do. My job is to see what is beyond the diagnosis and solve that. But then if we really has to conclude anything, we have to go to a therapist or a development pediatrician. They're very well versed in quantifying the problem. So I think if that is need to be done, probably we can go to a development pediatrician and they will score in the right way. They do some CAR scoring and some ATEC score and all that to come up with some quantification.
Yes. Okay, sir. Sir, now my next thing is, sir, I have only one son now, and we are planning to have another child, and we are a bit scared that shall we go for another child? What is the probability that my second child will not be autistic or will not have this problem? Any historical data says anything?
Okay, so lot like your child got autism. Okay,
yeah,
there was no history behind you or your family or your wife's family.
No, sir.
Right?
Yeah,
so
right.
not necessarily your second child will have a problem. There's no such thing. Now, if you maintain the same environment that is kept for the first child, for example, your wife has some infections. Let's suppose your child is not born non-normal delivery, child is born C-section. Mother was fed with folic acid during pregnancy.
Yeah, that is true. Yeah.
Post-pregnancy antibiotics, post-pregnancy, lot of these kids in this COVID time, what also has unfortunately multiple vaccines were given simultaneously. Now, because of the lockdown, people could not go to a doctor, and multiple 2-3 vaccines are shot because they missed it. Okay.
So
there could be multiple reasons which has led to the problem that we are facing today. But I would not conclude that because your one child has some problem does not mean that you will. But of course, as a culture, this country would always took care that we prepare the body before we get pregnant and during pregnancy and post-pregnancy. So if your family and you take care of that part, I think this is good enough to ensure that we don't get into the problem.
Sir, my last question, okay, it is a very minor thing, but as we have discussed, sir, I would like to have some idea, because this test procedure is actually comprises of multiple.
कॉस्ट वगैरह के बारे में
tests.
कल बात करेंगे और प्रोग्राम
Sir.
के प्रोसेस के बारे में कल बात करेंगे. In the interest of time, there are
Okay, sir. Okay, sir. Okay. Thank you very much for the now. Thank you very much.
Miss Varalakshmi, please go ahead. Miss Varalakshmi, you had a question, ma'am. Kindly push that red mic button to unmute yourself. You are muted. Red mic button. Okay, we'll come back to you, ma'am. Mr. Dinesh, please go ahead.
हेलो सर.
हाँ जी, go ahead.
हेलो.
हाँ जी, आवाज आ रही है, बोलिए.
हेलो.
आवाज आ रही है सर, go ahead.
हेलो.
Your voice is coming, please go ahead.
हेलो. हेलो.
Sir, please go ahead.
हेलो.
Voice is coming. आपकी
हेलो.
आवाज आ रही है.
हेलो. एक बार हेलो. हेलो सर.
Sir, I can hear you. Please go ahead with the question.
Hello. Sir, can you hear me, sir?
Yes, yes, yes.
Sir, we are having a child 5.5 years old. At the time of birth, he was having hydrocephalus problem. He is on VP shunt now. A regular physiotherapy exercise is going on from 4 years onwards. He is unable to speak and walk, sir.
Okay. So,
one dose of Botaxin has been given to him, sir. Hello.
Right, sir. I think this hydrocephalus, there has to be something wrong because there's inflammation and there's more this liquid formation in the brain. Okay, potentially that inflammation is also impacting the speech and all that. Now it is a little different than usual that kids would have. So I think before I comment anything, I would like to probably you can share some reports with Ayush. We'll look into it, any recent reports and treatment and whatnot. And then, based on reviewing the reports and all that, we might be able to comment on something, whether how much we will be able to help specifically to your child.
He is able to get up to his knees position, sir. If you hold him, he puts cross-legging, he is walking, putting his legs crossed, sir.
No, fine, sir. I'm saying, what is the status of the inflammation in the brain? Is it reduced? Is still there because the scientific are able to flow the water liquid, but still we need to evaluate before I comment, sir. Okay, some things I'm sure about I can comment, but some things I need to be sure before I say anything. So if
Regularly,
you can
we are in touch with
all
the
that.
doctor. Sir, regularly we are in touch with the doctor. The doctor says that the VP shunt is working properly, but the problem is in the tightness in his what do you call that, nerves or something like that. Because of that, he is not able to walk or stand properly. He stands on his fingers, sir, legs, fingers, toes. He individually gets up on his own.
Right, sir. So I am saying kindly share the reports and all details with Ayush. Okay. Let us review that and I will be able to comment. It's just too little of a time for me to even think through and then, comment. It's not a good idea. So
Definitely, I'll share the reports. Thank you, sir. Thank you.
Hi, sir. I'll go with Dinesh. So my kid is 3 years old for now, and he's going with a regular playgroup also. He's done with his playgroup too. We are also going parallelly with the behavioral therapy, and along with that, homeo we are using from last 20 days. Only problem we were facing with our kid is speech delay, which is being improved for now. Parallelly, can we use like this naturopathy? Is my question.
Yes, madam. Certainly.
And how long, like this therapy, this medications would help my child to be on normal? And since he's good at school, but only the speech delay was the complaint from the teachers, but the rest of part was fine with him. Like for my understanding, how long this may help my child to go with all these medications and therapies?
See, for how long? Till the internal problems are resolved. Test will confirm.
I'm sorry to interrupt. Actually, it's a virtual autism, sir.
I just explained properly. I think is if every parent little more aware, trying to be aware what I'm saying, I don't have to repeat myself. Okay, let's again talk about this virtual autism. One is the memory building, which is all right, still okay, but screen time will have electromagnetic fields which will do a damage to the physical body, to the mitochondria. Okay, electromagnetic fields of these screens also can cause certain infections in the body. That's a reality. And just because you think it is because of the screens only, but might it not be limited to that, what we think. So test would confirm what are the markers for infections and the mitochondrial damage and all that. They will sort of give us a clue how much, and generally until those markers are coming normal, every 3 months you test and see. Each step we pass, they will improve and improve till they're no more positive. Okay, and then I think, of course, symptomatically also things will improve as your markers are improving. It can, speech delay, let's say, give and take 6-9 months.
Okay, and like this is test will be done, like we can evaluate in home.
Test can be done at home, but you cannot evaluate a test. It's a very technical test. Okay.
Like we would definitely have the support from your team, right?
Yeah. How would you read those tests?
Make sure
Thank
you
you for
join
answering,
tomorrow.
sir.
We'll be discussing our approach and all that, so you'll know about this much.
Sure. Thank you.
Miss Richa, please go ahead, ma'am.
Yeah. Good evening, sir. I am husband of Richa.
Okay.
Yeah, I have 2 kids. One of my daughter is 13 years old. I have, as she was 3 years old, so MIR test, but I have no response. Or she mind not developing. She is just like a 3 years child behavior. So or I have no hope that she will cure or fully cure or not. And also I have one child, one son, is 9 years old. She is also hyperactive and toe walking भी सर इसकी है और repeating behavior है. ये सारी चीजें हैं. तो मेरे दोनों बच्चे ना, एक one is the autistic child and one of my son is ADHD. So we are facing both the childs.
So देखिए ADHD तो सॉल्व करना मुश्किल नहीं है. जैसे आपने कहा कि टो वॉकिंग है. टो वॉकिंग क्यों रहता है? क्योंकि इनके अंदर ऑक्सलेट प्रेजेंस होता है. ऑक्सलेट ज्यादा क्यों होता है? क्योंकि फंगल इन्फेक्शन होता है. फंगल इन्फेक्शन से भी हाइपर एक्टिविटी भी हो सकता है, ऑक्सलेट से टो वॉकिंग भी हो सकता है. ये तो मसला सॉल्व करना मुश्किल नहीं है. दिस इज प्रीटी सॉल्वेबल. नाउ 13 साल की बच्ची है, उसको इम्प्रूव तो बहुत कर सकते हैं, कोई डाउट नहीं, लेकिन समय लगेगा. धैर्य से पेशेंटली हमको उस पर काम करने पड़ेगा.
उसका माइंड अभी भी 3 इयर्स चाइल्ड जैसा है. अभी उसका माइंड डेवलप नहीं हो पा रहा है. 13 इयर्स में भी अभी लग रहा है कि 3 to 4 इयर्स का माइंड डेवलप है बस.
देखिए वो ठीक है बात, मैं समझ गया वो तो बात. लेकिन हमेशा अपनी बॉडी में क्षमता है बेहतर होने की, प्रोवाइडेड हम अपनी बॉडी को एनवायरनमेंट दे पाए, उस कंडीशन दे पाए. अगर देखिए एक ब्रेन के सेल के अंदर कम से कम 5000 से लेके 15000 माइटोकॉन्ड्रिया रहते हैं. अब वो माइटोकॉन्ड्रिया का नंबर, वो माइटोकॉन्ड्रिया की क्वालिटी डिफाइन करेगा कि मेरा ब्रेन फंक्शन कैसा होगा. अगर मैं बच्चे के सपोर्ट में माइटोकॉन्ड्रिया इंप्रूव करने की स्ट्रैटेजी, सप्लीमेंटेशन, फोटोथेरेपी वो सब करते हैं, तो अभी 3 साल का है, 5 साल का हो सकता है, फिर 8 साल का हो सकता है, फिर 10 का भी हो सकता है ना. वो धीरे इंप्रूव कर सकता है. लेकिन कंसिडरिंग 13 साल की बच्चे, समय लगेगा और एफर्ट ज्यादा लगेगा. 9 साल का बच्चा है तो रिलेटिवली प्रॉब्लम भी कम है, तो बिल्कुल वो तो सॉल्व हो सकता है, उसको प्रॉब्लम नहीं। सो हमेशा इम्प्रूवमेंट आ सकता है आपके बच्चे में, लेकिन कहना ये अभी मैं इसमें कंसिडरिंग कि 13 साल की, ये नहीं कहूँगा कंप्लीट रिकवरी। हाँ, इम्प्रूवमेंट आएगा 20%, 40%, 60%, वो हो सकता है।
सर इसको मैं आपसे पर्सनली भी कनेक्ट कर सकता हूँ इसको? हाँ,
कल जुड़िएगा सर, कल
चाइल्ड के लिए।
सारा डिटेल में डिस्कस।
ओके, थैंक यू सर।
मिस प्रियंका, प्लीज गो अहेड।
Hello, sir. Sir, thanks for this informative session. Sir, actually, I'm a father of a 2.7 years old son. So recently, when I visited for the pediatrician for the growth and everything, so they tell us that autism assessment has to be done based on the whatever the feedback we give for the son, that okay, I mean, he's not giving the eye contact and everything. And it is just now, I think 8 days back, assessment has been done, and I think they advise us for to start with the OT as well as the for the speech therapy and everything. Okay, so looking at your session, what I understand that, I mean, obviously they yet not categorize anything. It's a virtual autism, or just by listening this session, I came to know, okay, there are different variety of autism, because we are the pretty much new to this term and everything. So what could be your advice? Like, since it is a, as per the doctor say that it is a 2.6 years of old, I think soon we start, it can find the improvement, but based on the therapy only, or shall we go for any other, treatment, homeopathy treatment, or the functional treatment, the one I think you are expertise in? So, I mean, what could be your advice for us to go ahead further? Because obviously, whatever the way, we'll try to see the improvement. Obviously, it will take some time, but we don't want to leave any scope. Like we started with therapy, now any additional things we can do.
Of course. Let's reiterate. Okay.
Yeah.
There's an underlying problem which need to be resolved so that behavior can regress. Okay, bad behavior can regress.
Okay.
Now you cannot solve the underlying problem with the therapy.
Okay.
Now another thing that you have to understand, which is very, very critical to understand, is this underlying problem, if not resolved, it can increase also.
Correct.
There is a toxicity, if there's a deficiency of any other problem which is underlying the problem diagnosis, it can increase also over a period of time if we don't solve it. So lot of kids, they are on therapies, they find some improvements here and there, or all that happens, but underlying problem keep increasing.
Right.
Okay.
So basically, the functional approach you are saying, it's for that solving the underlying problem. That's what I think the detailed information we'll get on tomorrow's session, right?
That's right.
Okay. And one more thing, I think during 1 year of age of old, he got some remark. अचानक से बीमार पड़ गया, तो he found that doctor declared as a post-viral encephalitis. Some terminology was there, and after that, I can see some behavior like eye contacts and everything. So we take up the all the neurologists and all these EEG test, MRI and everything. Those came normal. And after 1 year, I think they advise for the autism assessment. So they are saying as of now mild, but there is scope of improvement. So yeah, definitely I will attend your tomorrow's session, and let's, I think, start with that. But I can do that with alongside with the therapy and the whatever the medicine currently going, right?
Yes.
Okay. Then it's fine. Okay, thank you.
Thank you.
Mr. Chinmay, please go ahead. Mr. Chinmay, you had a question? Chinmay Behra? Okay. Mr. Naveen, you had a question? Mr. Naveen, you had a question, sir? Vidita? Miss Vidita, do you want to ask a question? Vidita Pandey?
सर नमस्ते सर, चिन्मय बोल रहा है।
हाँ बोलिए
सर, एक्चुअली मैं प्लांट रख गया तो थोड़ा सा नेटवर्क का प्रॉब्लम हो गया। मैं घर में आपका पूरा बात सुन लिया था, ठीक है। तो मेरा बच्चा का अभी 4 इयर्स। हेलो
बोलिए।
और मेरा बच्चा का 4 इयर्स 3 मंथ है। उसका 3 इयर्स से थोड़ा सा आई कंटेक्ट और कुछ समझने में थोड़ा सा प्रॉब्लम था। तो मेरा डॉक्टर जो पीडियाट्रिशियन डॉक्टर है, वो कुछ D3 और दो तो कुछ 1200 समथिंग का जो विटामिन कुछ मेडिसिन लिख दिए थे, तो उसको मैं कंटिन्यू कर रहा हूँ। 4 या 3 मंथ के बाद तो मैं देख रहा हूँ थोड़ा सा इम्प्रूवमेंट है, तो उसको थोड़ा स्कूल भेजा हूँ। स्कूल में जाने के बाद वो थोड़ा बात को समझ नहीं पा रहा, और मैडम बोला उसको इम्प्रूवमेंट करिए, ये करिए। मैं वही जानना चाहता हूँ उसका इम्प्रूवमेंट हो रहा है कि नहीं हो रहा है। तो मैं ऐसा कुछ पेडिट्रिशियन के पास जाता हूँ तो वो बोलता है नहीं, वो धीरे धीरे इम्प्रूवमेंट होगा। तो वही आपका सजेशन चाहता हूँ कि क्या करूँ उसको अभी, और इसमें